Welcome to day 2 in our main stage of Sweden Innovation Days 2022. Today's theme is Preventive Health and Well-being. My name is Aurora Belfrage and I have the honor of being your Sherpa throughout these 4 days of summit. Short recap of yesterday, as we will build on that today. We need to innovate how we innovate. And there's a delta between what we say we ought to do and where we actually are. So in short, one of the things that we discussed a lot yesterday was this is unacceptable and it's time to dial up. And the sustainability transformation we discussed yesterday is to an extent a huge opportunity. However, as several speakers talked about, we need to rearrange our priorities. Let's be clear why we're doing this, what's at stake, collapse potentially. And only secondly, optimize for profitability and return on investment. We talked about the importance of reframing success and value. And as Director General of Vinnova, Darja Isaksson, framed it yesterday, this is an investment today we can't afford not to do. And it all boils down to missions. The innovation process to break down silos, to engage stakeholders, to holistically address a daunting and complex reality. And let's extrapolate this to preventive health and well-being, one of the big challenges of our time. Please meet to join me today is the co-moderator Anders Brinne. He's the strategic area lead sustainable precision health Vinnova. Anders, you will be with me throughout the day giving perspectives and commentary. Thank you. I was wondering, Anders, please tell us, when you're not in a studio like this, what's your daytime job? What do you do?
Yeah, I just want to start with thanking for this great opportunity. I mean, I feel like a 5-year-old here on Christmas morning, looking so much forward to listening and learning from the superb lineup that we have here today. So, as you said, I have the role of strategic area lead in precision health at Vinnova, the Swedish innovation agency. We have a brilliant team working on stimulating collaborative innovation in the Swedish health and life science systems. So what we're aiming for is more individualized and personalized healthcare that is more precision, but also to strengthen innovation in the field of preventive health.
We have an intense schedule for the next few hours. What are the few of the highlights of today that you're looking forward to?
Well, I hope that we can show today that preventive health is important, that it's not just a matter for the healthcare system, but the entire society has to be involved here. And that collaboration is absolutely necessary for us not to become better at sustaining health among the population, both nationally and internationally.
I mean, preventive health isn't new on the agenda, but would you say that this paradigm shift has happened, that we talk about preventive health, or are we still moving into it?
I think we are moving into it very much. I think there is a great opportunity and actually a great market opportunity as well, commercial opportunity to move into this field. We are working a little bit on what we call secondary health, where the healthcare system is working on patients with chronic disease, trying to prevent those patients from getting worse. But when we're talking about the primary prevention, which happens for healthy people, there is so many opportunities left for us to discover.
Brilliant. And Anders, you will join each and every panel today, and you will support me in questioning the keynotes, but also commenting and giving the Vinnova perspective on the panels we have today. And I'd like also to remind you guys about the chat that we have. It's an opportunity to discuss, comment, give your points of view. We also have the hashtag of the conference that you can use in LinkedIn to push parts that you find interesting that you'd like to comment on, or also highlight what you're doing within the field. So, preventive health and well-being is more important than ever, and might I add, clearly interlinked with climate and environment, as we discussed yesterday. Our next speaker is at the heart of the matter and has throughout her career worked relentlessly to strengthen Swedish healthcare and welfare. She will set the scene and the stage for today by reflecting on the current state of the sector, its progress, and how to move forward with collaboration, incentives, and innovation. She will present a global focus through a Swedish lens. I'd like to welcome Dr. Maja Fjestad, State Secretary to the Ministry of Health and Social Affairs.
Thank you so much, Aurora and Anders, for that very nice introduction. My name is Maja Fjestad. I am the State Secretary to the Minister of Health and Social Affairs in Sweden. It is my great pleasure to kick off Day 2 of the Swedish Innovation Days, today focusing on preventive health and well-being. I have been in the midst of the Swedish response against COVID-19 the last 2 years, and it is almost needless to say that the past 2 years have been overwhelming for all of us around the world. So many lives have been lost. Our health workforce has been stretched to the limit, and health systems have been challenged like never before. Many of us have lost loved ones. Economies have been severely affected too. The pandemic has shown that health is the foundation of functioning and wealthy societies. The pandemic has also illustrated how the Sustainable Development Goals are interlinked and how health, climate, and the environment are interdependent. To continue to improve health globally, we need not only health systems, but also societies enabling people to live healthy lives. In Sweden, Parliament has approved an ambitious agenda to improve health equity through the country, through actions across society, including education, transportation, community planning, and so on. Also, equality is a prerequisite for a healthy life. Almost 20 years ago, the Swedish government adopted a comprehensive national public health policy. Rather than addressing health problems, Swedish public health objectives address health determinants. The objectives are directed at the societal and cultural level and attempt to put health issues on both the political and the social agenda. Access to good and safe care is a fundamental part of a well-functioning society. Improving capacity for early diagnosis will create better conditions for treatment, prevention, self-management, as well as lower costs for treatment. Healthcare is going through a paradigm shift, moving towards a more personalized care and precision medicine. This means that collaboration with research and the private sector is an integrated part of healthcare provision, and that becomes necessity. How do we create a safe ecosystem that can make health data more accessible for research and innovation that is needed to take the step towards a more data-driven and precise healthcare? Sharing of data should always be preceded by a thorough assessment of patient benefit in relation to patient integrity. But I also think that putting integrity against digitalization is a false dichotomy. We can and we must do both. And never before has so much data been produced within the life sciences. The amount and the complexity of data is growing exponentially, and more scientific discoveries are enabled when data is openly available to researchers across the world. Drawing on Sweden's unique environment with national population registers, well-established biobanks, and disease-specific quality registers, analysis of real-world data is an area where Sweden is at the forefront. Through a new national data strategy, the government wants Sweden to become a leading data-sharing nation in artificial intelligence and digital innovation. In the life sciences area, digital infrastructures for cancer imaging and disease-specific registers are highlighted. For Sweden, e-health, digitalization, and a prospering life science sector is a long-term obligation. In the National Strategy for Life Sciences, we emphasize the importance of precision medicine. This must always be done with the patient in focus, with patients and by patients. The Swedish government also recently announced that it will establish an innovation hub for process development and large-scale production of advanced vaccines and biological drugs. This hub is also researched to raise the preparedness for future health crises, as well as a fantastic opportunity for international collaboration. Sweden has a long-standing commitment to global health through international cooperation, development assistance, and research and development. And we believe that international collaboration is the key to be able to respond better to future global health crises. And one thing we know for sure is that there will be more global health crises. The establishment of the UNICEF Global Innovation Office in Stockholm last year and the planned establishment of the International Vaccine Institute European Regional Office in Stockholm are just two recent examples. But we also have long-lasting cooperations with, for example, India, South Korea, Japan, Saudi Arabia, France, Germany, UK, and many more in the field of life sciences. My hope is that we, the life science sector of the world, can keep the same speed and the same engagement with which the new and safe vaccines against COVID-19 were developed going forward. The same speed must now be applied to develop new, safe and effective healthcare solutions and methods that can increase the quality of life, sustainability and the well-being that we seek to achieve with the 2030 Agenda. Antimicrobial resistance being one of our major global challenges. Sweden has a strong tradition in cross-sectoral collaboration, and as a small country, it has always been important for us to collaborate also with other countries. Yet we need to be better at collaborating and using resources available to build robust, innovative and resilient healthcare systems for the future. Thank you so much, and I will also see you later today during the last panel of the day. Thank you.
Thank you for that. You heard her. We've got work to do. And to highlight some of the activities and actions as part of that work, we have a word cloud, which you should be able to see on screen any second now. And we have a guest with us. Sasan Shaba, and I apologize for butchering your name, the International Director Ignite. Tell us about this word cloud and give us your instinctive reactions, spontaneous reactions to these words, obviously with the backdrop of what the State Secretary said.
Hello, Aurora. Anders, happy to be here with you. Hello from the headquarters of the matchmaking. Basically, as we see, exactly as you all said, digital e-health solutions for improving patient diagnostics and care are highlighting what we have seen from the needs of the corporates. Patient preparation, engagement, experience, and communication is also part of it. We see a lot of needs and health solutions such as like medical devices, wearables, IoT and digital solutions, remote monitoring of patients and chronic patients that improve efficiency and reduce unnecessary travel and visits to hospitals, for example, have been another area. Image recognition is another big area. Machine learning and AI is also an area that we have seen from the corporate needs that deliver substantial value through analysis of biometric data, for example, and health data, but also AI that can help to speed up and automate design cycles for both small and large molecules. Also, of course, patient data, secure patient data is also an area that have been on the board from the needs.
So from a matchmaking point of view, we've got hundreds of companies meeting corporates throughout this summit and basically seeing if we can find a match in real problems in terms of corporates' challenges and what the startups are looking at to solve. How have you measured success in terms of how this conference will go and the matchmaking will go?
I mean, basically, we have 24 partners in 10 countries. We had over 600 nominations of startups connected to all needs. But basically, what we measure is each meeting done, but the follow-ups that are made by the corporates. Actually, the corporates are the one that decide which startups they want to meet and they want to confirm a meeting with, but also that they want to have a follow-up meeting with. And the next step after the follow-up meeting, we also look at how many NDAs that are written, how many small pilots, commercial pilots, of course, that are done or prepared or initiated, and also the rollouts of these solutions. Basically, what we want, we are in this together. We want implementation of these innovative solutions. When we have done that, then we have succeeded.
Anders, I'd love to get the Vinnova perspective on this. So this is a matchmaking that Ignite has been doing for many years together with you. Anders, how do you pick up on the follow-up meetings, the tests, the initiatives that are taken after these type of matchmakings?
I think it's an excellent starting point to find new collaborations between companies. I really love this matchmaking sessions. I was wondering if you can see already now how the matchmaking looks when it comes to the challenges that the large corporations have described and the solutions proposed by the startups. Can you see the matches there already? Could you perhaps give an example as well?
Yeah, so we have done two parts, two matchmaking sessions of 6. And we have seen some of the corporates immediately, basically they take action in their 20-minute meeting. Either it's a no-go or a go or keep in touch. We have seen at least what we have been following up for the first moment. We have seen about 34% of direct follow-ups. And we have about 40 to 50% that will take a next discussion and see if that will be a follow-up. But basically, in all our matchmaking, we measure everything, and we have a hit rate of 50% of follow-ups, and that's our aim, of course, for this matchmaking. And we have seen some super cool matches that, after 10 minutes, they're like, we're going to follow up, they exchange contacts, and take next step.
Do you need to be a part of that? As in, do you need to facilitate the conversations in the cultural gap or anything like that?
Yeah, of course, we prepare all the corporates. We have a first meeting with them to activate them. We discuss with them about their budget, their initiative thoughts about actually working with startups so they understand it. We have decision makers from the corporates. When they go through a process where we deep dive in their needs, we basically write an NDA with each corporate, if they want it, of course, because they will tell us about things that are sensitive. So they are committed. We make sure that they are committed. When they do their confirms, and what we do is we take a long list from their need, based on their need. We do a long list of startups. We secure that long list to a short list of about 25 startups that we actually present and pitch for them. They confirm 7 meetings. And when they have confirmed these meetings, we basically do a brief call with each startups, telling them that, okay, you have a confirmed meeting with this corporate. You need to prepare this and that. We have sales boosts with them. We prepare them with all the necessary details. When they're in the meeting, we have sales coaches in each meeting.
Clearly, you have this under control. I see that this is a minute precision orchestrated by Ignite. So we look forward to hearing more about the successes and the measurements. Thank you for joining us.
Thank you so much.
Because now it's time for a deep dive. I think it's time to explore today's global health challenges. A summit like this can seem like a lot of talk, a lot of fancy words. But I assure you, our next speakers are all about action and the need to go and move beyond ideas. A lot has been learned from the pandemic that can be used to create positive impact for people around the world. But it's also important to consider the other and the more burning issues besides an ongoing pandemic. I'd like to welcome Anna Maria Ekström, Professor of Global Transformation for Health at Karolinska Institutet, Stefan Swartling Petersson, Professor of Global Transformations for Health at Karolinska Institutet. Well, the floor is yours.
Thank you. Thank you so much. We're very delighted to be here. Today we will not talk about diseases, but we will talk about health. And the most important determinant of health is poverty. As a consequence of the COVID pandemic, we have seen the World Bank has estimated that 100 million more people have been pushed into extreme poverty, and up to 160 million more now live on less than $5.50 per day. This is, of course, a major challenge. But if we look at it from a slightly longer perspective.
Yes, borrowing this slide here from Gapminder, we look at poverty's evolution over the last 30 years, and we can see the COVID bump there, the 160 million. It is a bump in the poverty reduction. So depending on how you see this, Anna-Mia, you can say, okay, let's carry on, let's pick up the pieces and carry on, and that's what we have to do. But the worrying thing is that the World Bank now says that we are looking at a two-speed recovery. Our part of the world, Sweden and others, we've stimulated the economy, so we're actually moving into hyperdrive. While as many poor countries are looking at a very slow recovery, and that is, of course, an extremely important health determinant, scarcity and poverty. However, if we move to slightly more proximate health determinants, we've borrowed a slide from our mentor, Anna-Mia's and mine, Hans Rosling, where he describes the main determinants for health in what he calls the health grip. And as you can see, it's a hand, and it has 5 fingers and 5 determinants. So we wanted to take you through a tour of these 5 determinants. And let me start with a very essential one, the food piece. The food, we put it on the thumb because without food, there's no health. Yet, my colleagues in UNICEF actually estimate that 2 out of 3 children in the world are not getting the food they need. They are getting too little, too much, or the wrong kind. And that is obviously a problem that requires innovation. Are these kids in this picture going to get affordable protein? At the same time, we are now getting too much food. We are getting overweight and obese in our part of the world, eating food that destroys the forests, that release 30% of climate emissions and bring us bad health. Surely we need innovation in the food space, and we need the Tesla game changer in the food space. And this is, I would say, a virgin place that needs to happen.
Definitely, and just adding to the food part and connecting it to the poverty aspect, we know that also poverty and school closures during the COVID pandemic has led to up to 40% of children in low and lower middle income countries missing their most important meal of the day when schools were closed. And also that over 130 million additional people have been pushed into hunger or severe hunger during the pandemic due to the world's reaction to the pandemic. Then moving over to air and water, WHO now estimates that 7 million people a year die from pollution. This is also a very high number in comparison. For example, 5.5 million people have so far been estimated to have died from COVID over the last 2 years. Air pollution doesn't only harm the lungs, but it can also cause heart disease. So we need a lot of innovation in this area. When it comes to water, it doesn't only mean quality in terms of the fact that we need clean water to drink, obviously, without lead or bacteria, but also in sufficient quantities. And and this is where the climate disaster projections really come in and give us a lot of cause of concern, because they estimate that already by 2025, as many as 2/3 of the world's population may be living in water-stressed regions. So there are, for sure, issues to resolve in this area too. Stefan.
Wonderful. Now, I'm now on the long finger, the social well-being. And I must say, I've been in family quarantine for COVID until today. And really, that is a short period. But anyone who's been in a lockdown, you know what it does to your mental health and well-being. Some kids I sponsor to schools have not been to schools for 2 years. What has that done? Not just to their schooling, but to their development and social and mental well-being. Adolescent mental health is deteriorating on the top of COVID. Clearly, we need innovation in that space. We need social innovation, as it were. What else?
Definitely. And when we talk about social well-being, we also come into social protection. Again, something that is extremely important and that we also see lacking in many, many parts of the world. The ILO just recently estimated that 53% of the world's population actually live without any social protection whatsoever. So when they are old, if they get sick, if they get unemployed, there is nothing there from society to pick them up. Or to fill in the gaps of income gaps, for example. And this is a major issue for health.
So we need innovation in social insurance then?
Definitely.
Yes, wonderful. Brilliant. Lots of for you people to do. Infrastructure. What's to say about infrastructure, Anna-Mia?
Well, as this photo illustrates, we have a problem with wastewater management, for example. We need affordable solutions for that. To clean the water that we just mentioned earlier is sort of a key determinant of health. We also need new infrastructures to ensure electricity coverage and access in the world, including internet access. This is something that we saw that millions and millions, hundreds of millions of children actually were lacking during school closures, which really impacts everything in the world.
But you know, I'm from a village, but that's not how people grow up these days. 55% of the world is urbanized, and we are soon hitting 70% urbanized. And unfortunately, many of those kids and families live in slums.
True. And in the slums, we often see that governments actually don't make an effort to invest, for example, in sewage systems.
Yeah.
Toilets, just the basic facts of living close to other people. You need a way to get rid of the waste and get rid of the sewage. And that is a major issue now, as you say,
Totally.
the majority live in urban slums, actually.
So housing, affordable housing, and city planning, by the way, that actually has us physically mobile rather than sitting on a train for the rest of us, and enough green spaces and pavements for kids to play, etc. So lots to do of innovation for health in the infrastructure space. But finally, we're both doctors, aren't we? We finally reached a small finger. Why is it a small finger?
Well, we know healthcare in many parts of the world, actually, a small proportion of people who are sick actually ever reach the healthcare system. So there's a lot to do before actually to increase access to healthcare, but also in terms of digitalization of data, of health data, so that we can actually use it properly to evaluate. I think there have been fantastic examples actually during the last pandemic of even real-time data increasing by the hour, almost changing data, and we see how helpful that is actually to the world, but we need that in all areas.
But certainly, I think, you know, we've been busy overwhelming health services with COVID patients now. But there is another massive tide overwhelming weak health services. It's the one of diabetes, obesity, heart disease. And we have weak health systems in the world that are not constructed for that. It requires innovation because we have episodic healthcare systems. Malaria today, cured tomorrow, bye-bye. And suddenly we need to keep track of Stefan and his diabetes and is he coming back or not. So that's one element I'd like to put out. And the other one I'd like to say, and I'm triple vaccinated. Isn't it fantastic? But in the world now, it's no longer the vaccine for COVID that is the problem. It's now the delivery system for the vaccine and it's the misinformation. So clearly we need innovation to make sure that healthcare moves on and becomes health and contributes to health as well.
Yes, and that more people become aware of what the different components of the health systems are. For example, the health information, as you mentioned, it's an extremely important component that we sometimes skip and think that it will resolve by itself. But we really need to invest much, much more. And in particular, as you say, to actually scale up access to COVID vaccines, we need to really work on fighting misinformation.
So we talked a lot now about the health determinants, and they go far beyond healthcare, as we've seen. And in fact, they go beyond even what we as humans makes us as humans healthy, because the way we've become relatively healthy in Sweden, the world cannot afford, can it, right?
No, we need, and there I actually feel a lot of hope. Just think about how the mobile phone access to mobile phones has been scaled up, for example, across the African continent, while never ever building telephone poles or rigging, cables across the continents, meaning that people in many countries can skip decades of development. And it's a fantastic innovation.
So we've launched this concept called sustainable health, saying that whatever innovation we do has to respect the planetary boundaries. You don't negotiate with physics. So please innovate.
Agreed.
Thank you, guys. That was fascinating and a great way to set the scene for today by broadening the concept. And obviously, healthcare is much more than healthcare when we talk about preventive. One of the things that I would like to ask you, but unfortunately we don't have time, you were highlighting we have work to do, so you have work to do. But hopefully throughout the day, we might be able to pinpoint who needs to do these things and how does that fit into the broader mission. And we do actually have a question from the audience. So please, state your name and profession and your question for the panelists.
Hi, this is Professor Ishan Gupta from Indian Institute of Technology in Delhi, in India. So I have a question, really interesting presentation. If you had extremely restricted budget in your country, as a poor country would have, what would you prioritize to obtain transformation out of all the things that you've mentioned?
If I can start, the food system. The food system and the food environment is so ready for transformation.
Yes, and I have a lot of hope into the vaccine development and actually ensuring in India, you know, you have it's a fantastic example of a local production of vaccines, which is actually contributing to the world very much, especially during COVID. But I think we need more vaccine production and also think of it in a broader sense, because prevention is almost always much less expensive than actually the treatment of diseases. So I think there will be a lot of innovation ahead in terms of vaccines, not only for infectious diseases, but also for non-communicable diseases. Actually.
But we need to do it together with young people, and that's why I'm excited that my UNICEF colleagues are coming here tomorrow and talk about UNICEF Office of Innovation in doing this together with the young people who are the future.
Thank you. I think we've highlighted several parts of this smorgasbord that we will be addressing today. And thank you for the audience question, also forcing us to pinpoint the priorities. What's the most important part here? Thank you, panel.
Thank you.
Thank you.
And now we will move on. And I'm excited to introduce our next speaker and explore something that seems intuitive, but historically hasn't played a significant part of our healthcare system: physical exercise. So without further ado, physical exercise on prescription. Are we experiencing a paradigm shift within preventive healthcare? This will be presented by Mats Börjesson, Professor, MD, Institute of Medicine, Sahlgrenska Academy, Center for Health and Performance, and Sahlgrenska University Hospital. Mats, floor is yours.
Thank you very much for inviting me. My talk today is about physical activity on prescription. Are we experiencing a paradigm shift within preventive health care? And I do believe that you have my slides, so I'm happy to have the first one. And we can go to the second one. Let me start with a statement. Lifestyle is sustainability. And we've heard a lot about external factors in previous talks here, and I would like to add also that to work truly sustainable, you have to also include the human beings. To address lifestyle behavior in this regard is to work towards human sustainability. And the next slide. And this has been really, next one please. This has been really evident in the ongoing COVID pandemic. As you can see from this and many other studies, the traditional risk factors having been associated with higher risk of hospitalization for COVID and even intensive care for COVID is, for instance, cardiovascular disease, hypertension, obesity, smoking, and insulin resistance. And these are lifestyle-related diseases and risk factors that regular physical activity could reduce the risk for. Going for the next slide, please. And we know that regular physical activity and fitness is associated to a lower risk of being hospitalized. And in fact, seeing here a study performed in 1.6 million Swedish conscripts made in Gothenburg, we can show that a fitness test at the age of 18 actually is associated with your risk of being hospitalized or even intensive care for COVID infection 30, 40 years later, showing the enormous effect of your lifestyle behavior and the early establishment of these risk of this lifestyle behavior. You can take the next one, please. As you can see in the next slide here, lifestyle actually contributes to the majority of our health, and this has been established many years ago, as you can see on the reference here. But it's even more important with lifestyle behavior than genetics, our environment, and access to medical care actually. And next one, please. And out of the different lifestyle behaviors, physical inactivity is an increasing and global health problem. 27.5% is now approximated to be insufficiently active, not meeting physical activity recommendations worldwide. But in fact, this is a figure which probably is much higher in reality, because we tend to overestimate our activity when we self-assess. So this problem is even more redundant, or even more common, I would say. And this makes it very important for us to find different methods to increase physical activity as part of regular health care, and these methods should be effective. Next one, please. So some of the barriers that the healthcare personnel in an interview study we did, asking them in Sweden, what is the reason why we don't do any more lifestyle counseling? And the answers we got was, we need more research evidence on the health benefits of activity, but also how to perform it. We don't have the money or time. We need the structural support from above. And very importantly, it's hard getting people to change behavior, which is true. But the most important factor may in fact be another thing as well, an additional thing. And you can take the next one. As shown on the next slide here, in a study performed by one of my PhD students, Amanda Ek, you can see the difference between what people think is important to do and what we actually do in healthcare. So healthcare personnel, in this case, it was the thoracic department at Karolinska Hospital in Stockholm, said that it's very important to work with all the classical lifestyle factors, that it's diet, alcohol, smoking, and physical inactivity. And it's also important in my practice. But I'm not asking the patients very much, and even less giving counseling. And the reason for that, the healthcare personnel says, is that we need and we lack clear routines and support from above. You can take the next one. But the patients are with us. They think physical inactivity, for instance, is one of the most important factors to change in their life right now. Importantly, as you can see in the second paragraph, they of course say this is part of their own responsibility to change their lifestyle behavior. But highlighted in red, you can see that 76%, 3 out of 4 patients, actually believe that the healthcare system is responsible for helping them be more physically active. And this might be surprising, but if you think about it a little longer, it's not, because the patients actually want us to be asking about lifestyle behavior, helping them change lifestyle behavior, and follow it up. You can take the next slide. So, to combat lifestyle-related disease, we need to address lifestyle behavior. Medications will not be enough, even if they are needed. Therefore, finding methods to increase physical activity for insufficiently active patients in healthcare is essential. Next slide, please. And then comes to methods to increase physical activity in healthcare. These has been used since the times of Hippocrates. That the most common thing throughout the history is the general advice. You should be more physically active. And this has been low efficiency, so to say. And if you add advice on physical activity with additional support, that could be step counters or diaries or follow-ups, then the yield will increase a little bit. Even more complex systems has been established. For instance, the exercise referral schemes, which consists of you being referred by a doctor, usually, to an exercise specialist, where you, at a facility, do your training for a limited time, say 18 to 16 weeks, and then you return to your normal life. These systems has been modestly successful and with mixed result, I would say, because they don't really change your behavior over time. And then we have the exercise on prescription model, illustrated here by the Swedish model, which differs in key components and is even more complex. You can take the next one. And just this busy slide shows that this physical activity referral schemes, they are in many countries, or have been used in many countries. The difference with the Swedish model is that you can see there is no time limit on it. And what we also have learned from previous studies is that you should try to target groups with the reduced resources and also have a social network around the patient. You can take the next slide, please. So what is the unique characteristics of the Swedish physical activity on prescription model then? Well, first of all, it's based on national guidelines. So these were established a few years ago and has been updated, saying that for insufficiently physically active patients in healthcare, we should give advice added on by pedometers or written prescriptions or actually adjuvant treatment according to the PAP model. You can take the next slide. But the most different thing about the Swedish model is that it's personalized and individualized. So you do get counseling and a recommendation on physical activity according to your disease or risk factor, but you also have a very individualized, personalized discussion and dialogue before that. For the prescription of activity, we use the evidence-based book, the FYS book. You can take the next slide, please. Which is a collection of all the evidence for physical activity for different diseases in terms of which type of activity, which intensity, which frequency and duration is the most effective for each disease. But it also includes the mode of action, side effects, and contraindications. And this book was first published 20 years ago, and now is the 4th edition and has been published in Vietnamese, English, and Norwegian, for instance. And this is the basic reference book. Next, please. But then again, then comes the second step, which is you have to individualize the prescription. You have to adjust the prescription for many other things. Because of preferences, barriers, and facilitators for each patient, multiple diseases or medication, motivational support and economic support for the patient, and also interest of the patient. So that will modify the individual prescription, and that's the uniqueness of the Swedish system, I would say. And also there is a structured follow-up. You can take the next slide, please. So, does the physical activity on prescription model, the Swedish way, work? Well, it has been extensively studied by at least 6 PhD theses in Sweden since 2008. And there has been numerous studies as part of these PhD studies and elsewhere. And it has been shown that the adherence to physical activity prescription is equal to medicine at 6 months. And the effect on increasing physical activity, whereby you gain all the health effects, has been shown for 6, 12, and up to 24 months. And there is a 5-year, the world's longest PAP study now ongoing in the Gothenburg physical activity and prescription study, where we will look at results after 5 years. So you can summarize in the next slide that there was a systematic review published a few years ago in British Journal of Sports Medicine, saying that yes, with good evidence, you can say that the Swedish model of physical activity on prescription will increase physical activity level in patients in healthcare being insufficiently active. And that is what we are asking for, really, a model that will work and increase the activity for our patients. You can take the next slide. And this has been followed by European Union naming the Swedish PAP model the best practice in European Union, and also establishing a 3-year European project led from Sweden, but involving 9 European countries, and where the educational part of the system took part at our facilities in Gothenburg, but it's a collaboration between 9 countries. And also the PAP model is now subject for OECD report in this year, I believe. So to conclude, the Swedish PAP model or is a model for exercise prescription to increase physical activity in patients. And such a model should be part of regular healthcare, actually. And that's my strong belief. Thank you. For next slide. To finish up, I would say yes to my initial question. There is a paradigm shift towards personal health. And this is what it's all about, really. To work with individualized prescription of physical activity, not one size fits all. To be truly individual, to reach more patients. We are truly apply personalized medicine, or rather personalized health. Thank you very much.
Thank you, Mats, for that. And as I said initially, it feels like it's a very intuitive step to take to add physical health as part of the healthcare system. Anders, can I ask you to jump in here? What are your thoughts when you've heard Mats talk about this paradigm shift?
Well, first of all, thank you very much, Mats, for a very good keynote. Well, we know, of course, that lifestyle is so important for our health. But we also know you touch a little bit upon this, that changing the behavior of people can be very, very difficult. So that's a question I have for you, Mats. Have you looked into that? How you can follow up that the patients prescribed with physical activity actually follow the plan? I mean, there is an abundance of things competing for our time today: TV, mobile phones, etc. So do you have any ideas around this? Is it an area where we need more research and innovation, perhaps?
I agree absolutely. And one of the key for behavioral change then is to show that the models you apply will actually increase the activity for the patients. And that's why it's so important that I show this systematic review of the Swedish model, showing that with high evidence we can say that yes, people are more physically active after the program. And sometimes you fall into the trap to show every single effect, but that's already shown in the Facebook and other evidence-based material. So really the key now is to make people more active, and then we will gain these health benefits. So I agree with you. I don't think the PAP model is the 100% perfect to reach everybody, but I do think we will reach more people because it's individualized and reaching some of the more higher hanging fruits, so to speak. And to use the old system of just one size fits all will only make a few of us active. So we have to have more individualized prescription. That's my take on it.
And Mats, just to underline, the main theme of this conference is obviously transformation and mission-oriented approach to this. And obviously adding physical health is a component in that. And you were talking about that the system calls it overwhelming. But could you also talk about maybe the cultural aspects of this type of transformation? Doctors not seeing it as part of their job, not part of my below my paycheck, etc. How does one work with that, the cultural?
Yeah, I also agree with that, because I think it's perfectly illustrated by the patients want us to be more active in this field. But we have been somewhat reluctant, but they actually urge us to do it. They say we should work with the lifestyle behavior, but they don't see it. So they expect us to do more. And I think it's time to take one step forward. And it's also illustrated by the views of the healthcare system personnel that's saying that the motivation of the patient is the biggest problem, besides structural support. But I also think our own motivation to work with this has to be increased. And
Mats, I'm going to use your line. Mats, I'm going to use your line. Take one step forward, and I'm going to urge everyone to take a physical step forward as we move to better healthcare. Thank you, Mats, for sharing and joining us today.
Thank you.
And Anders, on that, we have more content in that as we actually stand still, but we'll take a mental, physical step forward. And we have a Gapminder quiz that we've asked the audience that we can discuss. Can we see that on screen, please? There is our quiz. There's the QR code for anyone who wants to participate in the quizzes that are up and coming. There's one later today and more obviously on Wednesday and Thursday. And today's question was, what happened to the global suicide rate in the last 20 years? Anders, I'm going to put you on the spot. Did you know the answer?
Well, no, I didn't actually.
Well, I'm not sure the audience did either. There were two options. It's decreased by 25%. It's stayed about the same over the last 20 years, and it's decreased with about 25%. And as you see on the screen, the right answer is that it's decreased with 25%. And looking at this preventive health and well-being, which is our topic today, Anders, how do you see suicide rates as an important issue?
Well, of course, it is an important indicator, but one should be a little bit careful when you see figures like this, because it doesn't really say anything about why the rates are decreasing. Is it because we worked very hard with preventive work, or could it be a side effect of other changes in society? And we really don't know that. I mean, a more naive analysis would be, okay, we don't have to work anymore on improving our efforts to decrease suicide rates because it's already going in the right direction. It's of course it's good. It's a good indicator, but we have to be careful when you interpret it.
One of the things that you and I were discussing before this, when we were looking at the question, is the New Zealand's Prime Minister Jacinda Ardern. She has indicated that she wants to broaden the concept of GDP. How do you measure the success of a country into something more than just financial? And she's mentioned suicide rates, as well as obviously our debt to climate as one of the factors. How do you guys look at the concept of GDP and measuring broader value?
Well, I'm carefully positive. I think that there are a number of indicators showing how well a country is doing, and mixing them isn't always a good thing. I think for trending, it might be interesting to see how things develop over time. But then the suicide rate stands for itself, I think. And when it comes to comparing different countries, you must be very wary that suicide rates may be recorded differently in different countries. So it sounds like a good idea, but it might be tricky when you start looking at the details. And I mean, we see the same challenges today when we try to compare COVID statistics between countries, for example. It isn't very easy. So it depends on what you want to use the indicator for.
Thank you, Anders. And before we move on to the next topic of today, I'd like to push our audience to join the chat. Talk about the things that we're talking about. Share your comments, your views, your insights, and maybe highlight the things that you're doing within this, because these 4 days is about doing it together. And that is the only way to do it. We have a hashtag as well. And you are, please use it on LinkedIn or Twitter to contribute to the conversation. Now moving on, a recurring theme throughout yesterday, today, and I'm sure will be for the rest of the conference, is the balance, or maybe to spell it out a bit more clearly, the battle between framing our missions as costs or investments. And I'm thrilled to welcome the Swedish heavyweight and a huge inspiration for many of us, including me, the brilliant and tenacious Ebba Carbonier, Portfolio Manager for National Scalable Solutions for Health at SweLife at Karolinska Instituted Innovations. Ebba, could you just please take 2 minutes to give us context on health risk sick, invest 1 or pay 6?
Thank you so much, Aurora. And thank you for having this whole Sweden Innovation Days. I can start off with the 2 slides that we have regarding this healthy risk sick perspective, like Aurora mentioned. And if we look at it from a healthy risk sick perspective, we actually spend about 90, 95, 97% on trying to fix health when something has gone wrong. So this is all about the system transformation, which has got to do with incentives, payer models, and business models. And the OECD and WHO figures truly show as well that you can actually invest 1 and not have to pay 6. So shouldn't we do this investing 1 instead of having to pay 6 all the time? Next slide, please. So what are we doing then? We are working with this system transformation to really focus and invest in healthy from a healthy risk sick perspective. And of course, we shall talk about precision medicine, but we shall have precision health and basic health as well. And what we very concretely work with within a national project within Sweden, we have this prevention of childhood obesity project. So why do we do this prevention of childhood obesity? It's actually root causes, and it actually prevents having diabetes type 2, heart and cardiovascular diseases, and 13 types of cancers. So it's also actually prevention of some severe consequences of COVID-19. So that is what we do to prevent and really set off this system transformation. And we will have a film which shortly explains this prevention of childhood obesity and ending childhood obesity project that we work with 24 parties in Sweden. Thank you very much, and we will go on with the panel later on, but first of all with the film.
So childhood obesity has increased tenfold, and that has happened in the last 2 generations. This has been coupled to changes in society. In Sweden, more than 10% of children 4 years of age have overweight or even obesity. In some of these 4 years old, pre-diabetes has already developed. Type 2 is manifest already at age 11.
The child you see in the middle of the picture shows a classic situation of when a child living with obesity reaches school age. Children with obesity feel that they have failed. To quote a 20-year-old who has lived with obesity since an early age and who has been seriously sick from COVID-19. What if my parents, school nurses, and healthcare providers would have had more knowledge and give me support when I grow up? Maybe I wouldn't have got so sick by COVID-19, and maybe I wouldn't constantly worrying about my health. Every child has the right to a healthy start in life, the same way that every child has the right to go to school. It's our duty as an adult, decision makers and society to give the right conditions for our children.
Personal sufferings in combination with societal costs for obesity and related complications, which in Sweden amounts to 70 billion Swedish crowns annually, makes it imperative that we stop this development. Given this challenge, the Swedish National 10-year initiative Ending Childhood Obesity, or ECHO for short, was started in 2020. The aim of ECHO is to end childhood obesity at school start at 2030. To sustainably achieve the goal, a shift of society towards prevention is needed. ECHO is emphasizing that the environment around the child has to be changed into an environment that makes the healthy choice the easy choice. This is in contrast to healthcare, where focus is on the patient, the individual, and you try to do as much as possible, motivating and so forth. Here, much less focus is on the individual, but rather the environment. And if you want, making the environment normal again, because the abnormality that we see is a result of an abnormal environment. ECHO welcomes all countries to join the work of restoring our planet so that children can grow up healthy and not develop obesity and related complications like type 2 diabetes already early in life, which is now the case. We have to let aside, shall we say, old ways of formulating solutions and come up with new ones. So I think this is the perfect environment for innovative thinking. The collaboration between countries in this very, very challenging task is, I think, key to success. Then I think, yes, then I think we can actually make this happen.
Thank you, and thank you, Ebba. And let's get some more perspectives on this. As child obesity and diabetes rates grow rapidly around the world, insights and preventive methods on how they can be implemented has also grown. These learnings can be translated into best practices. And it's time to have a panel and discuss this. I'd like to welcome Carolina Klüft, Operations Manager at Generation PEP, Fredrik Söder, Founder and CEO of Health Integrator, and welcome back, Ebba Carbonnier. So, if we start this out, Fredrik, let me kick this off with you. What's your take from your perspective on how to implement new opportunities, how to address the right people?
Yeah, we are an integration platforms, so deliver health as a service, and that means that we can deliver health outcome and also bridging this financial gap between investing in health and see the health outcome. And the first case we're doing here is region in Stockholm, where we're preventing 50 to 60-year-old people develop type 2 diabetes. And there is a huge demand and need of this type of service. So far, we have reached 10% of this total target population and having them done risk screening for type 2 diabetes. And we see that there are really, really positive results of moving in this direction. So 44% of this group are already healthy after 6 months and out of risk zone of diabetes. 65% have lowered their glucose level and 8 out of 10 experience a better health. So this is really working like a digital vaccine. And so now we broaden this and moving into other group and looking into families and children as soon as it's user grouping.
That's great to hear. And Ebba, you set the scene today with the investment versus cost issue, and now moving that thinking into who do we need to target? Who are the right people that we need to motivate in order for that to happen? What's your take?
It's a very good question. What we have seen from studies is that first-time parents are willing to change their lives in quite a drastic way in order to do good for their child that is coming. So what Fredrik is talking about here is that we are going to initiate health obligations for first-time parents, for the family to be able to really make the right choices. So that is one area, and also the importance, like Peter Bergsten said here in the film, the importance of the community. So we have 5 municipalities where we will do these activities to really start off the prevention of childhood obesity in these smaller settings, because the whole community is needed as well.
I think that's a great point, and I think that's a great bridge, Carolina, to you, the importance of community. And could you tell us about Generation PEP and how you're working to address the right people and motivate the right people to make change?
Well, first of all, I would say that we try to motivate all young people, children and young people, because we know that all children have the right, just like we've seen in this film just now, that all children need to have this right. And we try to work in many different ways to really have this system change in the communities, in society around us, so we can have this environment around us that can really benefit from, the children can benefit from better lower barriers and better circumstances and better surroundings, so that physical activity can be accessible for them, so they can easy access to it and move around in schools, in preschools, in their spare time, so that we have like a shifting. We have to shift, and we have to be there, and we have to be close to the arenas or the areas where young people are. And we try, Generation PEP is working all the time to spread knowledge about the question, so that we can increase the knowledge all the time, but also initiatives, of course, that can change the circumstances and make benefits and better and lower barriers for physical activity and healthy food habits, of course, but also to cooperate with other organizations and clubs and schools and preschools, and to have a close cooperation and really develop things together, but also to guidance, to help people, just the individual, of course, to guide them how to be inspiration, find inspiration to move around, but also to give guidance to schools and to preschools, so really help to change in a very concrete and exact way.
Carolina, could you break it down for us further? We were listening to Mats earlier today that was talking about the physical health as a prescriptive part of the healthcare system, and how the system is slightly overwhelmed and doesn't know how to motivate and doesn't know how to add this into the processes, so to speak. So what are you doing, and who are you targeting the kids directly, parents, schools? What type of activities?
Well, not so much the kids directly. I think there are a lot of good organizations, bigger ones, and clubs and schools and preschools and so on that are good teachers and coaches and so on, that are really, really good in working with the children directly. So we try to give them a good guidance, knowledge and inspiration to really do a shifting in their organizations or in the schools or wherever they are, and to help them, to guide them, if you're a municipality or if it's a school or it's a preschool or it's the what you do on your spare time, or if you're a parent, to give them guidance, to give them knowledge, to know what can I do. And I think it's also about changing how we speak about these questions, because sometimes I think it's excluded. We talk about it so exclusively. I mean, I'm myself as a former athlete, and to talk about training and being active could, for some young people, be feeling very much excluded. So we need to talk about physical activity more in our regular life, and change, when you are in school, when you walk, you have safe travel back and forth to the school in an active way and so on. So you don't have to feel like you have to be a sporty person, or you're like to be in a different sport. You just need to have the ability to move around in your daily life. And I think we have to talk about these questions also.
So Carolina, we don't have to be Olympic gold medalers. Is that?
Oh no. There will always be maybe someone who wants to be Olympic gold medal. They are a bit crazy, I know that for sure. But the most important thing is, of course, to give them, the basis of having a healthy life, so that individually you feel like you have physical and mental health, so you can deal with your daily life. I mean, that's the most important thing, to have happy and healthy kids.
Anders, what do you think when you're hearing this? And both in terms of what Mats was talking about earlier, for me it sounds like this should be a natural part, but clearly we're having a conversation, there's a panel about it, this needs to be implemented. How do you work with that?
Yeah, I mean, I think this is an excellent example of how different actors can come together and actually work together to achieve important changes. And it's also something that we're trying to promote from Vinnova's perspective. I mean, we want to see these cross-sectorial collaboration initiatives. So it's really so great to see that you've achieved results already. I was just wondering, we talked a little bit about the food system in the initial keynote. Have you engaged anything in school food or other actors who may have impact on what children are eating? Ebba, perhaps?
Yes, it's a very good question, Anders. And of course, in this 24 partners initiative, the national collaboration around ending childhood obesity, we even have ICA, Livsmedelsverket, and quite a few actors where we have to make the system transformation there as well. And there are actually, for example, at kindergarten, there are directions that how one should prepare and what one should eat there. But the problem is that it's not followed. So unfortunately, there's a lot of sweet food, etc., when the children are very young. So this food environment, just like you're pointing towards, that this has to change in parallel with the physical activity, increasing the physical activity and focusing on eating the food according to the policies, because there are policies and directions on what food one should have.
And clearly, as everything we were discussing yesterday and today, there's so multiple strands of complexity in this issue. It's not one component that needs to be addressed, and then we can go home and be successful. And in this, I'd like to say that we've kind of framed the challenge now, and I'd like to spend the next part of the panel looking at what do we need to do, who needs to do, where do conversations need to happen in order for us in a year's time to say that we've moved the needle. And Fredrik, if I start with you, that's on the ground, like what would be your wish list for 2022 in order for this to move in the right direction?
First of all, I think you have to reflect here a bit. I mean, healthcare is very much the responsibility of healthcare, and it's very much a one-size-fits-all approach that Mats touched before. Moving into prevention, that's very much involved so many other type of partners, community partners, corporations, etc. And all of those need to be combined. So it's more like an ecosystem type of approach, but growing here. And that's a total different logic, approach, methodology to work dynamically around those individuals to create this change. And that is so different from how the systems is set up today, looking just at healthcare. And here, healthcare is one part of both responsibility, but also winner of keeping those individuals that are in the risk zone out of the healthcare system. So we need to find new ways of dynamically and constantly adapting to the changing world surrounding us, and also totally focus on what creates value and what brings outcome here. That's a very different way of working compared to how we work today. So I think focus on that would be extremely important.
I'm going to push you on this, Fredrik, because I think you've continued to highlight the challenges of the paradigm shift. And I think in order for us to move forward, I'd like to ask you to be slightly more tangible. And I'd like to echo the the audience question earlier. If you had to prioritize, what are the key activities that you want to do first?
Yeah, I mean, be very clear. I mean, Ebba, I think you stated before here that we spend 70 billion each year on child obesity. We know we can make a difference. So someone have made a decision that we should spend this money not doing what we know actually will change this, meaning prevention. So, I mean, we need to make those decisions starting to work in this direction. And that's very much a political decision. It's very much coming up with a solution and showing that this actually works and showing results.
So Ebba, that's a beautiful bridge to you. And this is where you've spent the majority of your career within municipalities, the political system and academia. How do we push this so that preventive becomes the new normal and not something novel that we're talking about?
Thank you. Some quantum computing and other things as well, but and cell and gene therapy. But of course, this prediction and prevention is totally key, and that's what we work with in the other projects as well. But really, one very concrete thing as well, just like Fredrik touched upon, but to be very concrete, what do we pay for in healthcare? This can be changed because as it is right now, you have to have a diagnosis until the system pays the doctor or hospital to do something. So to be a bit generalizing, if I would have pre-diabetes, they would sort of tell me, okay, come back when you have diabetes, because then we can start treating you. And that we have to change by paying for activities before. Because that's a big obstacle right now, that the system only gets paid for diagnosis if we generalize here. So that Sweden, as a large health system, we can change that.
And it sounds like intuitively that there's a very strong argument to be made here in terms of being prudent with taxpayers' money that makes sense. Anders, do you work with this as well from the Vinnova perspective?
Yes, of course, we're trying. And the interesting thing here, I think, is that you found, or you builded rather, a consortia where you can actually achieve this. Because otherwise, that's a challenge for us. We have to find who can take charge, who can drive this transformation. And there's no real clear actor who can be responsible for that. I think collaboration again is the key here, and to mobilize all the important actors towards a common goal. That's, I think, the only way to move forward as the system looks at the moment, I think.
Carolina, when we were having our pre-chat, you spontaneously delivered this beautiful one-liner, "I'm not waiting for the system." Tell us about how you've found the motivation and incentive to move forward without waiting for the system.
Well, I think we cannot wait until people make decisions in the right direction. I'm sure, and I'm really, I'm hoping for the right decision in all levels, and for that it will be leadership. We need courage. We need decision making that can put prevention much higher on their agendas. And I think I will not wait for that. We in Generation PEP, we try to do that all the time, and we do that together with so many people. We have a lot of them here today, and I think that's a way of trying to take your responsibility, and we have to have that in every level. So it's leadership, it's what we need. So and we cannot wait for the right person to make the right decision. We can all make decisions right now to make this to a better change. And I think for us, if I could just say one activity that if I have to pick something out that I want to happen during this year, I think still that schools are very important. Preschools, schools, and also what Ebba talked about when parents come with their small children, that in early stages of the kids' life, they will get the opportunity to be physical active. So we will not have this unequal health that we have in Sweden today, so that every child will have the chance to have a healthy life.
I think that sounds like a good place to start. And Ebba, if I give you the final word here, when we inaugurated the summit yesterday, we were talking about the importance of storytelling and communications, which I think ties into this leadership issue that Carolina was mentioning. If we would do the exercise here of being devil's advocate, what is the argument not to do this? Is there one of them? And I think that's probably a way to address a way forward.
We're a little bit stuck because we still think the surgeon is the coolest thing. So we're stuck in this sick part. So everything from incentive, payer models, business models, Nobel Prize, all the areas have to move backwards towards the health part.
And move in a physical sense, of course, because that's a key aspect here of this.
Definitely.
Some sort of preventive health Nobel Peace Prize will be on the wish list of what we want to see for 2022. This is a question that engages a lot of people because this is a core of civilization. And we have a question from the audience as well. Brazil is calling for Ebba. Please state your name and profession and your question.
My name is Luis Ari Messina. I come from Brazil, and I coordinate the Telemedicine University Network, RUCI. which is a health collaboration network organized by the Ministry of Science and Technology and Innovation and our Brazilian National Research and Education Network. Thank you so much for the invitation.
Please state your question.
If I can go on with the question?
Yes.
Okay. Well, but we started very early, actually, this health collaboration network already in 2006, 2007, with resources from Ministry of Science and Technology, but then also the Ministry of Health applied the same or similar model, so that today we have this collaborative network already with 140 university and teaching hospitals in Brazil. But we do not have yet a 10-year obesity, prevention obesity, childhood obesity program. The Ministry of Health has started, but it's a 1 year, which will be continuously going on. And we are very helpful also for the discussion with Professor Dr. Peter Bergsten for advancing this international collaboration. So in this sense, I hope we go on. And what will then be the next health challenges besides achieving the childhood obesity prevention?
Thank you, Luis, and we very much appreciate the collaboration, the countries together, Brazil and Sweden. I would definitely say that what the next big health challenge is really the enormously fast increasing amount of diabetes type 2 and heart and cardiovascular diseases, and also these types of cancers that are associated with our lifestyle. So I would actually, again, go back to, so what is the root cause of these diabetes cases and cancers and heart and cardiovascular cases? It's actually to have a healthy start in life, to prevent childhood obesity from the start, because otherwise our economies and our sufferings will just escalate too much. So the next big thing, or we have it already with diabetes and heart and cardiovascular and the cancers associated with our lifestyle. What's your take, Luis?
Yes, and I was very much happy to hear the Ministry of Health, Ministry of Sweden say, putting emphasis on international collaboration and collaborative networks. So our intention is to increase these opportunities, as we do have these teaching and university hospitals already with the conscience of international collaboration and network collaborative works. So this is my...
Thank you. Thank you for your question.
I mean, we all have this problem with childhood obesity, so we have the possibility to do it right from the start. Thank you.
Thank you so much.
Preventive health is a paradigm shift, and we have several aspects of this. Thank you, panel. Thank you, Frederick. Thank you, Carolina. Thank you, Ebba. And thank you, Brazil, for calling in and discussing that. And hopefully we will see some of your names nominated to the new Nobel Prize of Preventive Health 2022. And there is no shortage of burning issues to tackle. And it's time to discuss the role of antibiotics and antibiotic resistance, a key enabler and threat to global health. We have yet another esteemed panel, and we will discuss the usage of antibiotics and the effect they have on global health and what can be improved. Specifically, we will dive into new methods of working with antibiotics that can affect cancer care. So, I'd like to welcome Kristina Lagerstedt, CEO and co-founder of 1928 Diagnostics, Otto Kars, Senior Professor Infectious Disease at Uppsala University, founder and senior advisor of REACT, and Ulrika Åre-Kågström, Secretary General of Cancerfonden. Welcome to the panel. So hopefully you've been listening in to today and our discussions of preventive health and remodeling the calculation of how to do this, invest versus cost. And now we're going to add antibiotics to this. Christina, if I start with you, what's your take on this big topic? Looks like you're muted.
Thank you so much for the invitation to participate in this panel together with Otto and Ulrika. So I'm the CEO and founder of 1928 Diagnostics, a company that is a health tech company based in Gothenburg. And we started 1928 with a clear mission, that is to save the power of antibiotics. But how are we doing that? Well, we help hospitals to outsmart superbugs. So what are superbugs? Superbugs are bacteria, virus, or fungi with two main characteristics. One, they are resistant to treatment, and two, they are very good at spreading. So what we contributed with at 1928 is that we have developed a software that runs in the cloud that analyze DNA from superbugs. So our customers, hospital laboratories all around the world, they upload DNA data from superbugs to our platform. And within minutes, they get back a result. And this result says, first of all, identifies a superbug, for instance, a bacteria. Second, it gives a profile of the bacteria to facilitate treatment decisions. And third, it does explain transmission of bacteria so that we can understand superbugs are spread, bacterial spread, and also to share this data between hospitals. But this is not, actually, I will not talk more about 1928, because what I want to do is to share a personal story. A story that emphasizes the power of antibiotics in cancer treatment. Because before I started 1928, I was a cancer scientist working with children with leukemia. And 1 year ago, my mother was diagnosed with acute myeloid leukemia, which is a very severe disease. 10 years ago, she would not have survived. But today, due to the progress of precision medicine in cancer and microbiology, she is still alive and she has a good quality of life, although she will not be cured. From day one, the medical team at Karolinska Hospital in Sweden have monitored her and her disease and given her personalized treatment with chemotherapy. She had experienced several bloodstream infections, out of 3 of them caused by antibiotic-resistant bacteria. But due to fantastic new technology and skills at the microbiology lab at Karolinska, they gave her the correct treatment, the correct antibiotics, so she survived. Here she is. Just to finalize this, access to antibiotics. Without access to antibiotics, none of the efforts or all the costs for treatment, it would have been wasted if they weren't access to antibiotics. I think this is a very clear example on how important it is for us together to save the power of antibiotics to be able to cure cancer. Not cure cancer, but to maintain the quality of life in cancer patients. So over to you, Otto, or to Aurore.
Thank you, Christina. Thank you for sharing that. And we're glad to see that your mother is doing well. And with that as a backdrop, Otto, could you share with us, how do you see the role of antibiotics and antibiotic resistance and its impact on global health?
I mean, today I think many people regard antibiotic resistance as a human right. And because everyone's had access to it, in...
Continue.
Please, Otto. Christina, can we wait 2 seconds and let...
Sorry, yes.
All right, thanks. Thank you for inviting me to this very important panel, and also listening to Christina. Thank you for updating on your science, but not the least for your personal story, because I think we really need more of those. The key thing here. I have been devoting most of my professional life to antibiotic and antibiotic resistance, first as a clinician, researcher in the lab and in the clinic, but also then moving into policy making. And on behalf of the Swedish government, I led the Swedish work on antibiotic resistance for more than 10 years. And now, since 15 years back, I'm involved in REACT, Action on Antibiotic Resistance, which is an international network present in all continents that are dealing with this challenge and trying to support countries with tools to handle this. Antibiotic resistance is absolutely one of the largest global infectious killers, if not the largest one. But it's not only the numerous individual deaths we're talking about here. It's also the fact that, as you alluded to, Christina, the effective antibiotics is building, is the foundation of all modern medicine. All healthcare is really building on this. And we see now how these fundamentals are crumbling and threatening cancer treatment, transplantations, and survival of premature newborns, and so forth. But antibiotic resistance also is a fundament for basic healthcare, and its consequences therefore goes beyond, surely beyond health. It is really a challenge to sustainable development and fulfillment of many of the sustainable development goals, in fact. So having worked for so many years on this, it's truly frustrating to see how slowly the world has reacted to this problem. And I think there are numerous explanations to this, but it's not a disease in itself. There are no voices, there are no patient organizations, and no bottom-up sort of push. But also one important question is, factor is that we have been fooled into some self-deception. There will always be new antibiotic around the corner when the old one is worn out and stopped working. And this is not the case. We know the painful truth is that it's not the case. There is very little in the pipeline. So today, the innovative capacity no longer lies with the big pharmaceutical industry. It lies with academia and smaller biotech companies, which have their problem to push through innovations. So I think we need to create a completely new ecosystem where the development of new treatments, as well as diagnostics and bacterial vaccines, are speeded up through new ways of collaboration. We need, alluding to one of the catchphrases in this exercise, we need to innovate how we innovate. But innovation is broader than science. I mean, it's everything is science, but innovation is also need to engage how we engage with the society as a whole more broadly, and to change behavior and social norms, now to engage professionals, and not the least whole of governments, including and development ministers. And again, we need to see this as a systems transformation starting from prevention. Prevention is key. But finally, I would say, maybe preempting some of the discussions, but I think antibiotics is a global resource, and we haven't been handling this as a global resource. We need to take responsibility for it. And I think we need to move forward towards something that could be called a Paris-like agreement on how to reserve this enormously important resource. So that's my basics. Thank you.
Well, thank you, Otto, for that. And there's several aspects of that I'd like to unpack, both in terms of this preventive aspect. Is this a question of mitigation versus innovation? What does that look like? But also this disease issue, how do we challenge that? So that's for you, Anders, in a second. But first, I'd like to add Ulrika to the conversation. What does this mean from a cancer care perspective?
Well, I think I'll probably repeat some of the things mentioned by Otto and Christina, because today it's estimated that at least 1 in 5 cancer patients need antibiotics during their cancer treatment. And the consequences for cancer treatment when antibiotics are no longer effective against resistant bacteria is serious, because people living with cancer really rely on antibiotics for the prevention and treatment of infections. And antibiotics are crucial, for example, for safe cancer surgery. And AMR could really set cancer treatment back decades. And I think it's really important that we understand how serious it is. And this, at the same time, in parallel with the rising incidence of cancer cases we see in the coming decades or years. And for the patients, this may mean instead of more survival, as we've seen so far, it may mean higher mortality, more difficult, more expensive treatment, and many side and late effects. And many treatment options that we take for granted today might disappear entirely if I really sort of talk about this very seriously. But it could also have major consequences for patients' interactions, requiring, for example, healthcare professionals or family members taking precautions, using like yellow coats for protective isolation, confinement rooms during treatment, if effective drugs aren't available. We know there is a need for more data because we don't really have the knowledge about the number of patients getting an infection with MRSA, nor how many that are actually treated with antibiotics. But I think we have there's a window of opportunity. We have an opportunity to take advantage of the knowledge and connection to cancer treatment in order to have sort of greater sense of urgency around AMR, because so many people are affected with cancer. And since antibiotics are essential for cancer treatment, we can actually use this to sort of create a sense of urgency around AMR. So that's really why this is key to the Swedish Cancer Society, Cancer Fonden, and all cancer organizations around the world.
Sharing your perspectives on that. And Anders, if I allow you to come in here for a second, and Otto framed it with frustrated, and I think frustration is one of the key emotions that we felt throughout the day, because many of these things feels intuitively like the right thing that we should do. How do we take this aspect and frame it into a mission that we can then achieve? Solve this for us, Anders, is what I'm basically saying.
Yeah, exactly.
Please.
I'm working on it. Well, how do we frame it into a mission? Well, first of all, we have to have all the important players around the table and get all the topics on the table and see which direction we should go together and who does what. And I think there are already initiatives ongoing tackling various aspects of this challenge. I mean, when it comes to finding new business models for pharma companies, you know, we want to use as little antibiotics as possible, and that doesn't really fit into the business models of most companies who want to sell as much as possible. We need to find new innovative models there, and we're working on that. When we're looking at new ideas of how we can prevent antibacterial resistance to spread in society. We need to find new ways to do that, new ways of working, and it's also something that we're trying very hard to do. So there are a lot of things going on, but I think we need more time, and we need more resources to make it. And also, I think what Otto also mentions, we need to really go global and do this across the entire planet. We can't just make this happen in Sweden, even though, I mean, we are at the forefront when it comes to antimicrobial resistance in Sweden, but we need to find ways to scale this globally.
Is there learnings or opportunities from COVID in terms of creating this council or global body? You were mentioning a Paris-like agreement, Otto.
Yeah, absolutely. There are many learnings. I mean, first of all, in record time, we have diagnostics. Without them, we have never been able to cope with this pandemic at all. There are also limitations, of course. There are nationalism, and we have not been supporting the developing world as we should have. But there are definitely learnings. This is also why I think in the forthcoming discussions at WHO, when they will start discussing a forthcoming legal instrument, a pandemic treaty, we need to place AMR in that treaty. That would be the place where we can discuss how to prevent and how to innovate and how to secure that the technologies that arrive out of a global collaboration really is delivering to all those in need. So I think there are definitely learnings, and we think we should capitalize on that.
So let's use this arena. That's why we have this summit, and we have our state secretary coming back for a panel a little later. How do we do this practically? What are the steps necessary? What are the bodies? How do we formulate it? What's the storytelling and the practical steps? I'm going to open that question up for anyone who would has a creative ideas.
I have a question for Otto. When it comes, because you have such an impressive background and been working within this area for so long, do you have any good examples on fruitful collaborations that have resulted in actual action that we can learn from and maybe continue do the same thing?
Yeah, I can answer that, and also coming back to the broader issue as well, where do we start? I mean, for sure, there is one good example. This is an EU initiative that was triggered by the Swedish EU presidency in 2009, which is called Enable, which is a small body, publicly funded, but also with in-kind of contributions from the pharmaceutical industry, including big pharma, academia, small pharma, researchers. It's a virtual drug company that takes the first steps in an innovation of new antibiotics. Unfortunately, that was almost stopped because this was a project for 5 or 6 years from the EU Commission, and then we tried to convince them to keep it on, but that was not possible within the sort of framework they're working. But fortunately, the Swedish government has at least made it surviving for at least 1 more year. This is an example how we could move together, collaborate, do it simple, not simple, but cheaper and more cost effective. And I think we need to have that sense of collaboration all across. So where do we start? We need to have a bottom up. We need to have more storytelling. We need to have better narrative to make people, including politicians and everyone, to understand the crisis, first of all. I think that's where to start, and also get the good data. And by the way, on Thursday, you may look into the Lancet, because we have a new upcoming study. There is an upcoming study on the burden of antibiotic resistance coming.
Well, look forward to that. And Christina, Ulrika, I'm going to give you the last word here.
May I just add on that, because I think it's so right what you're saying, Otto, and I think we all see the urge of international cooperation and collaboration and new funding models. But I think really it's also the key of the storytelling and putting the patient and their stories in the center, because it feels a bit far away. It feels a bit scientific. It doesn't feel really connected to me and my next of kin. So I think we really need to have an awareness among the public and among health professionals about the importance and the sort of life and death feeling in this, and what it may mean for all of us if we see a negative future in this area, a negative development. And I think organizations like cancer societies can do a lot better work in the storytelling part of it.
Anders, you've got your work cut out as one of the coordinating bodies in this, and I think we've highlighted some of the aspects. It's not a disease, and therefore the storytelling and the narrative is halting a little, and it needs a global approach, and Sweden is pioneering, and we need to put this on the agenda in a way that matters. And as Ulrika was alluding to, maybe there's a fear factor that needs to be addressed. You're nodding, so you know the seriousness of the assignment.
Perfectly agree. Yeah.
Thank you, esteemed panel. We could talk about this for a long time, but unfortunately we need to cut off here. Thank you for joining us and sharing your thoughts.
Thank you very much.
Thank you.
And now we have a new panel. And I will introduce that panel. This is an innovation summit, and we've early on set the ambition to discuss innovation in the broadest sense of the word. And I think that's important. Innovation socially, emotionally, politically, organizationally. But we can't have an innovation summit without talking about it from a technical point of view. So, technology for better healthcare, what does the future look like? Machine learning and robotics have the potential to transform preventive health and detection work. But there are challenges that we must overcome. Is it safe for everyone? Do we really want all the possibilities that technology can give us? And yet again, we have an esteemed panel with us to discuss the aspects of preventive and predictive health from a technology point of view. I'd like to welcome Amy Lutfi, the Professor of Information Technology and Head of Center of Applied Autonomous Sensor Systems at Örebro University. And there we go, stop. And I would like to also welcome Anna Berg Åsberg, the Vice President R&D of IT at AstraZeneca, Håkan Gustafsson, AI Coordinator, Region Östergötland Docent, and Deputy Director, Center for Medical Image Science and Visualization at Linköping University. So Amy, welcome. Let's start with you. From your perspective, what does technology look like for better healthcare?
Well, I think you touched on something very important, which is prevention, right? And we heard 2 panels ago just how important prevention is. And one could ask, okay, well, how do we prevent, for example, illness? How do we know what actions we should take to stay healthy? And an important answer to that question is research, right? That we conduct research, and we conduct research by doing empirical studies, and we really collect, I should say, fact-based information to support our decisions. And it's here that AI makes an important entry. So I do believe AI is a very powerful technology for doing diagnostics. It's a very powerful technology for personalized medicine, but we shouldn't underestimate its power for helping researchers discover new information about what leads to better health. And let me just give you a very short example of how this can be done. So at Örebro University, we have a few very specialized areas. One of them is food and health, and the other is AI and robotics. And we decided to combine our forces to see how we can make innovations to support each other. And we studied in particular what are the effects of, for example, a plant-based diet on our health. And the question here is, how can AI be an important toolbox for this research? So what we're currently developing together is a technology. In this case, it's a pill equipped with a camera that you swallow. And that in itself perhaps is not so innovative, but what we do with other researchers in Sweden is cover this pill with interesting gels, and we use image processing techniques in order to see how those gels change behavior as they're moving through our digestive system. Now, this in itself is very innovative, and it's just one example of a tool that we want to give the researchers so that they can uncover and do knowledge discovery about, in this case, how a plant-based diet affects our health. But in the large perspective, I would like to really lift the ability for AI to, as I said, discover new information and contribute to the fact that we want a knowledge-based society and make decisions based on fact and investigation.
Thank you, Amy. That sounds fascinating. I look forward to looking at the results from that. And before we unpack some of the stuff that you were talking about, I'd like to ask Håkan to join us. What does this mean from your perspective, and how do you work with technology in healthcare?
Oh, thank you for the invitation. From my perspective here at CMIV at Linköping University and Region Östergötland, we are very much interested in how to store structured healthcare data so we can make those data available for both research and but also for instance, preventive medicine or precision medicine. I would say the one very interesting part of this is, of course, the legal obstacles and what is possible today from a legal perspective. I'm very much involved in a pre-study at Region Östergötland where we look into these things. It's easy to say that it's not easy to understand what can be done today. For instance, can data from one clinic be, how to say, grouped together with the data from another clinic and make those data available for research? So we are very much involved in the legal aspects of that. On the other hand, at CMIV, where I'm situated, there are already successful projects regarding use of structured data for instance, artificial intelligence in pathology. There is, for instance, this large project, Big Picture, where electronic images from pathology will be used to develop new artificial intelligence tools. And there is also a lot of projects going on. For instance, I run a project where we use artificial intelligence in mammography screening in Region Östergötland. But I would, how to say, my take of this is that we need to discuss the legal aspects and what need to be done in the future to be able to use the vast amount of information that can be used, for instance, to preventive medicine, but may today be prevented by legal obstacles here in Sweden, but also I would say around the world.
Thank you for that, Håkan. And one of the topics of this is obviously looking at specific technologies, but also in the context of a transformational change. And I think it's interesting that, especially when it comes to AI in healthcare, we always add this additional question of, do we want all the aspects? What's the safe way to do it? And I don't know exactly how she framed it, but the State Secretary started in her inaugurating talk to say that there might not be a direct polar opposition between data and security. And I'd like to discuss that further with you as well, Håkan and the others. But before that, Anna, how do you and AstraZeneca think about and work with tech and healthcare? Anna, you're muted. And while Anna's looking at her tech, finding the right button, we will go back to you then on that, Håkan. How do you see that?
Can you hear me now?
Ah, there you go.
Okay, thank you. So, the future is think sometimes. And I think it's already here, but it's not really transforming yet. It's more transforming in a smaller scale. So just look at some of the examples. So it's about using technology to enhance our understanding of disease biology and turning data into knowledge. And one example is we are on a path to get over 2 million genomics sequenced by 2026. And that will allow us to understand more about the disease, the drivers and the mechanisms, so we can target it much more precisely. Data science and AI are already started to transform the speed to get the medicines to the patient, but also driving insights earlier so we can bring more cost efficiency and have much more higher probability of success when it gets there. And I think that's really transformational. It typically takes 10 years for pharma to get the medicine to the patient. And if we can cut that down with data and AI and technology, that's transformational. Also, we work a lot with patients in clinical trials, for example, and bringing tech in can be transformational of bringing in more frictionless and more sustainable ways of operating with the patients and make it much more easier and more insightful to participate in a clinical trial. And then one of my favorite examples that already is here is image analysis. And one is, how can you detect cancer earlier and increase the probability of success? And one of the examples we have is a collaboration with an Indian company where we use standard of care, so X-ray. Lung cancer is really hard to detect on a normal X-ray. But with AI, you can actually make it possible to detect very early with X-ray. And maybe it doesn't sound very transformational, but think about it. Now, millions and millions of people in countries where they maybe can't afford much more diagnosis, now through your standard of care can detect lung cancer earlier, and not only a higher probability of success, but also the care is there much more broadly. When you detect it earlier, it's a shorter care, it's a quicker one, and it's more affordable. So I think bringing it to large scale, and in particular for third countries, is really, really important, and it's democratizing the access to healthcare. So technology is already here, but it's not already spread, and it's so much more we can do.
Thank you for sharing that. Anders, what are your reflections when you've heard the panel talk about this?
Yeah, I thought the closing remark there was from Anna was pretty good, that we already have technological advancements that can be put to use. So my question to the whole panel is, well, first of all, it's notable that there is no representative of healthcare here when we're discussing the future of healthcare. But of course, the tech field is driven mostly by academy and the private sector, of course. But panel, how is your view on the need for a sort of long-term public-private platform to develop and test and scale new technological solutions where healthcare and patients can be involved? Are there such platforms available, or is there a gap here?
Amy?
Yeah, so I would say the answer is imperative in the sense that there's an urgent need for these kinds of environments. And I think there actually are some budding examples. And one of them is related to precision health and creating innovation environments. This was actually a call that Vinnova has had, where there's a number of innovation environments looking at how we can create innovations for precision health. But notably, many of these environments are using, again, AI as a toolbox. And I think here it's important that as these environments sort of work with their particular work plans, that they're really including, as you said, the full diversity of different actors. So we have the patients, we have the healthcare sector, and the researchers, all really in tight collaboration with each other.
Håkan, what's your take?
I can agree, and I'm very lucky to be a part of one of those projects that was financed in this precision health initiative, and I really agree. What we do in that project is creating a national platform to validate artificial intelligence in mammography, but later on take those experiences and move to other areas where AI tools also need to be validated. For instance, AI tools in pathology and other AI tools in radiology. I agree, for instance, I have virtually a CT behind me here, and detection of lung cancer using CT is, of course, something that can be done early, for instance, but we lack radiologists in Sweden. So I think the use of artificial intelligence, for instance, to reduce the need of double reading of CT examinations will be very, very important, but we need to validate those tools. There are a lot of publication proof of concept, and most of those tools are CE marked, but still we need to understand, is there a value for the healthcare system, or is it not? And I think that can best be performed in national platforms for images, for instance.
So before we go on to listing and addressing some of the challenges, Anna, we're going to talk about public-private and NASTA's work in collaborating with the startup scene in the next panel. But could you please comment on how do you see this working best?
I think it's really important, as you will hear in the next session too, that it's not, I think innovation really happens when you have different thoughts and coming together. And I think it's startups, it's academia, it's healthcare companies, it's public sector need to come together and collaborate if we want to move at speed. And if we really want to get to and solve some of these problems, it's easier if we have some of those more common platforms to collaborate on. And I think that could take Sweden a little bit more in the forefront on innovation. And I think it's really important. And Magnus will talk more about how important and what actually happens when you put those together on the platform.
I'm going to resist my urge to ask questions about what cool tech is coming, pioneering this, because that's a panel in itself. And what I'd like us to address is the transformational part and how technology is part of preventive health and well-being, and how it is part of the system change as well as the cool aspects of tech that's going on. So Amy, if you take a minute or two to talk about what are the main challenges that you see from your perspective, where tech is either hindered or not moving in quick enough in order for the transformational change of the topic of today.
Yeah, excellent question. And I want to be an optimist. So I'm going to cast your challenges also as opportunities. So one of the challenge that we heard earlier was the challenge of legalities. And as you said, they don't necessarily have to be polar opposites to each other. The question here is, how can we make this kind of lemon into a lemonade? And I think one way to do that is to, again, focus on that word innovation. And herein comes, again, another fantastic AI innovation, which is the ability to create synthetic data. So when we want to maybe circumvent the problem of working with very sensitive data, there are new AI technologies that allow us to create synthetic data sets. So challenge, working with GDPR and privacy, opportunity, new AI methods. So that's one example.
Amy, I applaud you for finding a tech solution to the challenge and giving us some cool tech anyway. But if I'm going to force you a little, what are your main challenges moving forward? What would you need to see happen in 2022 to make your life easier?
Yeah, so I think what I need to see happen in 2022, if you have to twist my arm, which you are, is really how do we work outside of those silos? So we were all labeled as technologists, and I mean I can accept that. But the point is that when I work, my work is always enriched in the meeting with people from different disciplines. But we have different languages, we have different standpoints, and really coming together is not so easy. Having these multidisciplinary environments between health practitioners and the tech nerds like myself are sometimes, they sometimes are a bit, hard to get things going and get things moving. So if you don't want me to be the optimist and just really point to problems, I think, we need to solve that multidisciplinary bridge.
It's not, Amy, that I want to highlight problems. I think we need to move forward, and therefore we need to be transparent to where the issues are in order to solve them, especially when we have Vinnova listening here. So Anders is taking notes of what we need to do. Håkan, we don't have that much time, but from your point of view, what would you like us to address over the next year in order to move the needle?
I think the important questions has already been addressed, and I'm very optimistic that I can see that E-hälsomyndigheten, for instance, have already got the task to understand if national databases can be created, for instance, for images, radiology images. So I think what we need to do the coming year is to work hard in those areas that has already been pointed out. So I'm very, very optimistic that we will move forward during this year, trying to understand the legal possibilities and also the legal obstacles. So that is maybe not the right answer, but I think we already know where the work is needed to be done this year, from my perspective.
So the task is get going, work harder. Anna, what's your point of view here?
Yeah, so I have 3 points here. So number one is about keeping, as this is new tech, as a technologist, we can get very excited about what's now possible, but it's about having a framework about ethical use of technology and data. So we always use it in an ethical way. And we have our own ethical data code of ethics, but I think coming together around exactly where is the line, where should we use it, where shouldn't we use it. The second one is, of course, access to data, access to patient data, and putting that in hands. And that goes together with the third point, which is really about the change management, about having health practitioners coming together with tech nerds and understand what's now possible and what's actually needed, and put that together in an ethical way. And it's both access to data bringing that platform where you actually can have this coming together, but also to make sure we do drive through the change and look into what's possible and actually lean into the future and take advantage of what actually is possible today.
Let's end there. Lean into the future, work harder, use what's possible, because there is interesting tech and it has a key part to play in the transformation of preventive healthcare and well-being. Thank you, esteemed panel. And with that, I would like you to add to this conversation. And again, there is a chat. Contribute, comment, tell us what you think, and highlight what you're doing in this space. There's also a hashtag. Please use it. Contribute to the conversation on LinkedIn. And now, Anders, we have another Gapminder question. Second Gapminder question for today, and I'm soon going to put you on the spot, Anders, to see if you got it right. How many people in the world have access to safe drinking water in their home or close by?
I think I underestimated how many people have water.
The options are 30%, around 50%, or around 70%.
Yeah, my guess was 50.
Your guess was 50. Well, actually, our audience was much more clued in than you, and the right answer is 70%. And probably almost 70% of the audience knew that. But Anders, why are we talking about safe drinking water, and why is it important in this context? Maybe I'm saying an obvious question, but...
Obviously, we need water to survive, obviously. But there are so many other sustainability perspectives around water as well. Equality, we have, of course, armed conflicts over water, and which can cause migration. So water is, I mean, of course, it's the most important thing we have on our planet, and we have to be very, very, very careful what we do with it and make the best use of it, so to speak.
Well, thank you for highlighting that, and I think it's important that we do that here as well, because we can't do preventive health or well-being without clean access to water. And as the Gapminder questions always do, they highlight the positive aspect of this. And Anders, we have a few minutes, and I thought maybe we would address that there is something good about addressing the opportunity, the hope, where things have moved forward and progressing. But also, this summit is about a sense of urgency. We need to move faster. These transformations are complex, and we are many times behind our goals. How do you see, and how does Vinnova work with this sense of urgency versus hope and opportunity?
Well, that's a very good question. I mean, we are really trying to create a sense of urgency where we see it's needed. And when it comes to this question regarding the water, of course, when you look at it from the Gapminder perspective, that 70% have access to water, with a global population of around 8 billion people, there are still 2.5 billion who don't have access to clear water. So we have to sort of keep in mind the numbers here and use the statistics wisely. That being said, there's still a huge potential in sort of designing or defining positive goals and positive visions, because that's what mobilization is all about. It's much easier to mobilize important actors around a positive goal. So rather than using challenges, we're sort of shifting now towards using positive visions of where we want to be in the future. So I think we need both. We need a sense of urgency, but we also need to have positive views of where we want to go in the future.
Thank you. And let's go to the next panel. So it might seem easy to talk about the need for innovation. And as we've all seen, forward-leaning politicians love to make headlines about the need for innovation or the need for entrepreneurship, as if it's a button to push and simsalabim, we have innovation. So let's discuss how we create a framework, fertile soils for that magic of innovation, that spark that allows an ignition, followed by the possibility to grow, to be tested, to be scaled, to be funded. And as we've discussed today, become the new normal. Innovation in itself doesn't matter. It needs to grow and be used. And obviously, if we knew the formula for this, we'd all be able to pack and go home and be done with this. Because it is a tricky issue, and there's a chicken and a hen perspective here that I think we need to discuss. So let's get the perspectives and learn from experience of the next panelist. And with that, I'd like to start the film. Varför skjuter vi alla bumpers?
The Bioventure Hub is all about the power of togetherness.
Nej, men det var 2 bumpers som var
mixing more than 30 small companies inside AstraZeneca, we try to catalyze innovation across the verticals of diagnostics, digital, medtech, and drugs. It's all about the power of togetherness.
To have a thriving ecosystem around the AstraZeneca Gothenburg site is very important to us. This is all about collaborating with the best across the board so that we can bring the very best medicines to patients in the future. And it's no longer just about biology, it's also about technology, data, and all of that.
Well, the Bioventure Hub really helps a lot when we talk about digital innovation, but it really comes down to the people and the environment. Being able to have such wonderful coworkers here at Ondosis, but as well as the wonderful individuals at the other companies, have really created a blending environment of biotech, digital, pharmaceutical, as well as the well-grounded, established information and great individuals of AstraZeneca that we can leverage to really bring amazing offers to the market.
Beautiful, wonderful.
Take.
Fantastic.
Good.
The cool thing about being here is, of course, the amazing infrastructure is provided by the large pharmaceutical company to small players such as us, creating quite a diverse infrastructure where we really can make use of each other. We help the large pharma, they help us, and it's a give and take situation.
Yeah, I think the hub helps us in 2 kind of concrete ways. First, it puts us in a room, or rather in a building, with a bunch of companies that bring in all different types of competencies from biology, physics, computer science, and we can work together and help each other out. And it also allows us to make further connections with people in the AstraZeneca organization who are also working with different aspects of whether it's biology or, again, whether it's AI or machine learning.
What's cool about the Bioventure Hub is that the Bioventure Hub is an example of not only diversity but inclusion as well. Due to that the Bioventure Hub exposes AstraZeneca to different companies and capabilities, each with a mixture of different thinking, alternative ways of working, and new technologies. This then automatically forces AstraZeneca to think more diverse, creating more innovation at the same time.
The BioX is our flagship bioprinter. The coolest thing is the freedom. You can design any model you want to in your computer, and then the 3D bioprinter can print it. Anything from simple squares to advanced tissue models of skin in different layers, liver with vasculature inside.
I think the Bioventure Hub is cool because it's brave of us to share our whole culture. And also I think that's what makes innovation thrive. When you share culture, you share innovation, and you discuss the ideas with each other.
We didn't have a recipe. We have treated this like a huge experiment from day one. And I sometimes get the question, what would you have done differently? And my answer is nothing, because we have already changed our mind 300 times.
I think that future collaborations where we put our brilliant minds together will catapult the solutions to the problems that the scientific community is facing and will face in the future. That's what you want to hear, right?
It's a really, really invigorating place to work at.
What's cool about Sweden is truly the work-life balance, where
Oh shit. Nearly there.
Cool, I can do it.
So, welcome to our panelists. Ebba Hallersjö-Hult, Head of Vision Zero Cancer. Magnus Björnsnö, Executive Director AstraZeneca at the BioVenture Hub that we just saw the film about. And Dr. Maja Fjestad's-Back, State Secretary to the Minister for Health and Social Affairs. And Anders Brinne is with us. So we're going to talk about the magic of collaboration and joining forces for the future to reach the UN Sustainable Development Goals 3. As we say, great innovation can start in a garage, but the greatest innovations of our time are more likely to stem from collaboration than in isolation, even though the other is a better narrative for media point of view. And is there a golden recipe for global health innovation? And how can we make a difference together? I'd like to start with our State Secretary. Maja, you touched upon this in your opening remarks, the importance of collaboration. Could you please elaborate for us?
Thank you so much, and thank you for inviting me. I think we often have a rather simplified and maybe even idealized view on innovation. I think the idea of the lone inventor, as you say, in a garage still exists. But true innovation is always put into a social and cultural context. I think an excellent example of this is Johannes Gutenberg from the 15th century and the invention of the mechanical movable printing press. Gutenberg, who really brought printing into Europe. And this might seem like a brilliant idea from a lone man, not maybe in a garage, but in a craft shop or something like that. But the 15th century is a very interesting time, actually. It's a time where literacy is developed, for example. There wouldn't be much idea with printing if no one could read it, right? But literacy is developed during the 15th century. And also the paper trade with China is really developed in the 15th century. Without paper, well, you all know that Europe didn't sort of catch the trick of making paper until way later. But if you would print on parchment, you would need an entire herd of livestock. So paper was obviously important to start large-scale printing in Europe. So this is one example, I think, how innovation is always tied together with societal change and how societal change is a prerequisite for innovation. And how does that feed into health innovation in the 21st century? And I think that one example of this really is patient participation, which I touched upon earlier today, and how no great innovation is really being developed in the health sector without participation of patients. And I think one concrete example is how we've been working with young adults in the cancer care, where it was highlighted a few years ago that cancer care really was developed for older individuals and not really for teenagers, for example, with cancer, and where we've had very interesting projects, some of you have heard about it, called MinCode, to develop innovative solutions to support teenagers and young adults with cancer. And I think this might be one example to translate the innovative spirit of the 15th century into what really is the spirit behind the SDGs. How can we make health and societal change be part of each other?
Thank you, Maja, for that. And just a warning, we've had lots of questions throughout the panels, and some of them have been directed to you. So there will be some follow-up from other challenges here. And innovation is obviously a part of that. And Anders at Vinnova has a long to-do list based on what we've been talking about. But Ebba, before we go into that, what's your take on this topic?
I agree with the Secretary, Maja Fjestad, that it's nothing about innovation in isolation. And I think what we're trying to do in Vision Zero Cancer is to innovate also how we innovate and how we can create new forms of governance that fosters new ways of working and innovation. And I think even talking about how do we reach the Sustainable Development Goal with health and well-being is not either an aspect of isolation, because for that to happen, you also need to make sure that you have access to clean water, to health with the cities, literacy, education. So it really is about taking a holistic approach and making sure that you get all the actors that are relevant for different solutions to be developed or implemented to work together. So that's what we are striving to do, to find sort of convening around the table all those actors that need to come together, to work together on a concrete solution. And mainly also finding the prerequisite to actually implement them in a sustainable way in society.
Which highlights one of the things that we've been discussing throughout today and yesterday is that this holistic approach, to use your terminology. There are always different stakeholders and actors in each challenge or mission, so to speak. But it always boils down to it's hard to meet, it's hard to talk different languages, different cultures, different sets of agendas. Which is probably at the core of how we need to solve these things. Before we go into that, Magnus, the film showed your take on collaboration, but could you tell us more about how you see the benefits and how you shape your role to secure some sort of success in this?
Yeah, thank you, and hi everyone. No, I think we all know that collaboration is indeed it's a collaborative endeavor, and based on where life science is heading, I think it's evident that the definition of innovation is about to change. And this means that we also need to redefine what we mean when we talk about the ecosystem. And what we have learned over the years, so what we have done is basically to combine 4 different industry verticals into the same environment. And we have purposely done it in such a way that we try to avoid competition. So you could argue it's about non-competitive complementarity. And it has been about not, this may sound a bit odd, but I think if you believe that you know what you do, you're on a dangerous turf because science isn't that easy. So instead of going into the normal way of shaping collaboration based on agreements with you know, well-articulated milestones and what have you, it pushes you in a certain direction. And I think science really needs to be driven by curiosity. And what we are trying to do in the BioHub is to merge different types of competences that will pave the way for the type of innovation I believe will be necessary in the future. And it is about combining diagnostics with digital, with medtech, and with pharma, and with care providers and patients. And how do you create an environment where all of that can flower together, basically?
Thank you for that. Adding more questions to this topic. And Maya, I'm going to ask you to address this, because one of the elephants in the room is how do we, from a government and a top-down perspective, do this? You sit in a department that has a set of questions that you're responsible for. In a parallel silo, there's other questions that obviously have huge impact on everything that we do. How do you work in adding stakeholders and having a holistic approach within the government?
I think it's of course interesting. What is the role of policymakers in this? And it's important to keep, I think, for all policymakers to keep a fair distance, of course, to research and development. I mean, we don't want to build a society where technology is governed by politicians. On the other hand, we want to develop democratic technology. And I think the concept of technopolitics is very interesting. I mean, we need maybe even a stronger democratic influence on technological development, and definitely on how technology is integrated in our society. And I think more focus should be put on that. But of course, the general answer would be that as a politician, my task is really to create a good environment for innovation, a good environment for cooperation, and a good environment for life science, of course, particularly in my case. And that is it's not always self-evident how to do that. And I think it's interesting, me myself being sort of a tech person moving into the health sector, I often look with envy on how used the medical sector is to work in multidisciplinary teams. I mean, there's a century-long tradition of working multidisciplinary, which I think many other sectors in the innovation system actually can learn from.
And others, you are Sweden's innovation agency. How do you see collaboration?
Well, to us, of course, collaboration is the key, and we've heard it throughout the day here. So I'm so happy that the message that we try to give has been actually picked up by the actors in the system. So that's great. One thing that I have a question for Maya about collaborative innovation from our perspective is that it's very often project based. And many of the actors that we talk to, they are expressing a need for more long-term and more sustainable partnerships. So from a government perspective, do you see any possible alternatives for how we can organize collaborative innovation in the future?
Maya, I think that's a question. That's a question for you. And the meta question is, how do we get funding for longer periods of time to do our work? That would be my translation.
I didn't say exactly that, but no, of course, being State Secretary for Health, we can add another challenge, and that is our regional system. And I think that the challenges with the regional organization of healthcare has been well highlighted during the last 2 years. But let's remember that there are also a few benefits actually of having a regional-based health system. But I think, I mean, the cases where we really reached success in state-regional partnerships are really examples like Genomic Sweden, where we pool our funding together, where we have a strong common view, and that can sound self-evident, but maybe the sad part of this is that it isn't. But the times when regions and state and national actors pool their views together and pool their resources, I think we can actually develop fantastic change. But on the other hand, there is of course too many examples of where regional development and national development are being drawn in different directions.
Let's get Maya off the hot spot for a second where you can breathe and go to you, Ebba, and talk about, because it's very easy to, in a panel like this or a summit like this or in a strategic document, say the importance of collaboration. And we use these big words to address these topics, and then we can feel good about ourselves. I've talked about the power of collaboration. But what does that mean for you on the ground when you work?
For me, on the ground, when I work, we established a couple of years ago Vision Zero Cancer as a collaborative structure with a partially funding them for 5 years from Vinnova, and I think also funding that risk of finding new ways of working together. And in the core partnership, we have secured to have people and organizations who are passionate about supporting and working together to drive change from within the system. So we have in our case also working very much with the Confederation of the Regional Cancer Centers, together with one of our core partners, AstraZeneca, and with all the culture and knowledge from the AstraZeneca BioVenture Hub. That brings in a lot of knowledge. And then other partners from working with leadership organization, like Stockholm School of Economics, Electa, bringing in their technology. So we have different technology and medical partners, but also working through the system and then working across all areas within the healthcare, with academia. But it's also about combining, setting accountabilities on everybody. Everybody has to sort of wanting to be in a kind of a club of the willing, but also club of the contributing. Also contributing, investing with time, with their knowledge, with money, so that we can actually bring about change, and trying to find new constellations who can co-create something together. So it's also about driving, the incentives to change the system, but in policy innovation to drive forward new ideas, so that we can sort of shorten the lead time from a new solution or to solve a problem to actually make it happen. And I think it will require also new sectors working more together, more with the civic society as well, and definitely solving financial ideas and so on.
I love the phrase, the club of the willing. I think that sounds like a much better than Fight Club, of the willing. And from an AstraZeneca point of view, in a film that we saw, you've created a bit of a platform for that. And one of the myths around innovation is that the incumbent isn't a contributor in the innovation landscape, but and the startups need to fight the incumbent and that whole narrative. How do you see that evolving and the importance of working together?
I think it's important to ask yourself, what is the purpose of collaborating? I mean, if the purpose is to collaborate in order to exploit your competences and your abilities versus exploring, it becomes very, very different. And we are solely focusing on exploration. And I think we perhaps more often should ask ourselves, when we talk about collaboration, what is the driver here? Because if it is about exploitation, it is a partnership that is driven by business needs and monetary terms in the end. But when it comes to exploration, I think we can be more innovative in how we work together, because the purpose will be different. And based on where we are heading, the necessity of exploring becomes much, much more important than it was only 5 years ago. And I think having Maja on the spot here, and you asked before what the government could do, I think if we believe that the patient really needs to be engaged, and I think we all realize the necessity of that, we need to secure that the hospital can participate also in exploration. And that's what I see is a big thing that we could do that could change things. So for us, the BioHub is all about exploring rather than exploiting.
And I think reading between the lines here, one of the themes for the conference, but also what you're trying to say is, how do we prioritize between this return on investment, the financial, as well as how do we solve the big problems of our time? And these don't always go hand in hand. So Maja, you're back on in the hot seat again. How do we look at these aspects of why we exploit versus explore?
I think it's interesting. I would at least try to throw it back to Magnus. But what are there legal obstacles really for exploring in relationship to patients, or are the obstacles more financial? That would be a follow-up.
I think it's both. It's both culture, which is none of the two you mentioned. I think from a legal point of view, my personal view, Maja, is that sometimes I feel it's more important to protect data than to use data. And we need to move to a realization about the value of using data. So that is an obstacle. And then if you look on the budgets in the hospitals, what proportion is used to support innovation versus providing care? So I think it's not easy to be on that side, independent on how willing you are to be part of innovation. I think we need to create room for it, and we need to realize the long-term value of it. And I think it's very evident when you look at the country like, for example, Israel, the way they are trying to use the power of innovation to move healthcare. And I think we are too much stuck in here and now problems, rather than asking ourselves, how do we pay the way for where we need to be tomorrow? I don't know whether I answered your question, but I think it's a combination of a lot of factors. But I think mentality and culture is super important.
I think it's very interesting. I mean, in many points, I mean, of course, I internally argue all the time that research has to be a part of healthcare. And how should I explain? Well, of course, there's different budget parts of the budget that are directed to innovation and healthcare, but I think we need to continuously argue that innovation and research and clinical studies is an integrated part of medical care, medical development, and health. I also think it's interesting. I mean, you point at the data issue, and that's of course an issue with many different aspects. I mean, we keep running into what I think is a false dichotomy. Putting integrity and digitalization or development as opposites. I touched on that earlier today, but on the other hand, we need to, I mean, what do we need a government for in the data issues? We could, of course, be very hands-off, but there are a few aspects, I think, where we need a government in data. Of course, there's a sort of a basic protection of data, of course, to be able to have confidence for the individual in digitalization. I mean, we every day check the box when we sign up for Facebook or whatever, and do we accept the facts and conditions? Yeah, and what did we do in the 19th century? Well, we signed off the conditions with an employer until a strong working protection legislation were in place. And I'm thinking sometimes that is really what we need a government for in the data issues. We need sort of a ground level of individual protections to be able to innovate from that. But instead, we tend to have government or agencies that are very from above. I mean, cutting down on individual ways of that data handling, which sometimes are not very successful. I'm sure we have many different examples of how that's been unsuccessful.
No, and I know this is not easy, but I think if we could ask ourselves, is the main purpose protection or usage? That puts you in a different share depending on how you discuss this. And
But it must be both, mustn't it? Isn't that like? I think that's a false way of
yes,
saying
you
it.
need both, but I think at least what I experience is that the default position is protect rather than use. And if we could shift those two, and of course you need to balance it because this is serious matters and it must be done in the right way. But I think any country that can facilitate this will become a very interesting territory for collaborative innovation and research. And if we want to be part of that, I think we need to stop talking and we need to move into action.
Stop
No, we
talking
should have the best prerequisites. Sorry.
Stop talking has been the theme of the day anyway, and we only have a few minutes left, so we have to stop talking. And I'm going to let Anders. What would be a framing question here to end this panel, from your point of view?
Well, I think my framing question is what are the real success factors behind successful cross-sector, cross-disciplinary collaboration? I think I want to direct it specifically to Ebba, because she's the one who's been working really intensely on this topic for over the last 2 years, I know. So what are the success factors, Ebba?
Yeah. Some of the success factors is that you have to make sure that, as coming back to the Club of the Willing, bringing together people who contribute to being prepared to learn from each other, being honest about we don't know what the future is going to look like, but we know that we can together, people, shape that future society. So by being a bit more open and honest in that side, you are able to create that trust and everyone wanting to contribute with different solutions. And I think it's also about wanting to dare to partner, as we say, and dare to explore the unusual people and organizations to come in to bring more perspective to different questions, and then of course being committed and creating a structure that works, so that because you create teams, we have created in Sweden and abroad already, who works from different organizations. It becomes like a network organization, and with that you have to have some good simple rules together that you go about, and to play a bit bold and having partners who are willing to take risk as well, and being comfortable, not knowing really what will the future look like, and feel comfortable about navigating in a stormy sea sometimes.
And I think those insights is what we have to bring back to shape innovation policy for the future.
Yes, and I was thinking also, and in that comes also reshaping our financial systems so that research is a natural part of healthcare, for instance, and patient as research partners, etc., and creating the right incentives. And so there's a lot we can do together in Sweden and abroad, of course, working with Sweden.
There's a lot we can do, and collaboration has been a key part of all the panel discussions today. And framing the challenges hasn't been difficult, so to speak. We know what many of the challenges are, and we also know how to list the parallel strands of affecting parameters on each issue that are outside the normal silos of it. But again, it's easy to sit and talk about this and this and that, and in your Club of Willing, we could use the Swedish analogy of the smorgasbord, adding different elements to that conversation. Because at the end of the day, we can't fail. We can't sit here in a year's time to talk about this again in terms of how we need to meet.
Could I just add what I forgot to say? Perhaps in that you have to, with this group of that sort of Club of Willing, where you bring in more actors and people, you have to make sure that you set the direction together, and that's why it's a good framework to work in a mission-oriented way, because you have tools and frameworks already developed by others, and there's a lot to use to actually be practical and hands-on and start doing things, and to mobilize the system and build that capacity, and that capacity comes back to resources, funding, and so on. But you also have to follow up, and you have to set your targets. You work towards a vision or something long where you don't really know exactly where you're heading, because no one knows the future, but on that way with quite good toll gates and milestones, and also putting more of learning KPIs to it as well.
No one knows the future, and Maya, I can tell you, today has been a smorgasbord of people that are willing, they want to contribute and collaborate, both within the system and without the system. So feel supported in your work, and Anders has been taking notes of what they're going to do, and he's going to come and ask for more money to do that as well, just so you know.
Oh, you're welcome.
And I will be happy to spend it. Thank you, panel, for discussing the importance and the magic of collaboration and innovation with us.
Thank you very much.
Thank you so much.
Thank you.
So, in this club of the willing, I think it's an analogy that we're going to use throughout the conference, we obviously have the matchmaking that's been happening in parallel to the main stage. Companies meeting corporates discussing real needs, and now we have a few minutes to meet two of them. Because in this segment that we call Tomorrow's Solutions, we can meet two startups. Because during the Sweden Innovation Days, hundreds of startup scale-ups from 10 different countries have met with over 90 international corporates and public organizations in a curated matchmaking organized by Ignite Sweden. I think throughout the event so far, 470 meetings will be held. And as we heard this morning, measured right, left, and center in terms of next steps, projects happening, next meetings happening. And now we get to meet two of them. The South Korean startup Koshel, and I'm going to get help on the pronunciation on that, and Latent AI, and learn about their new technology. So welcome.
Thank you.
So I butchered you, and I feel awful about it, but there you go. My name is complicated too. So if we start with you, Jags, tell us, you're the co-founder and CEO of Latent AI. How do you work? What do you do? And what problem are you solving?
Thank you. Thank you for having us here. We are part of, we are from California, USA. We build developer tools to bring AI models to the edge. The edge can be sensors all the way at the very end of the network, and all the way to the edge of the network with different computing devices. Our software helps developers size models of any size to bring them to the edge. So that's what we do.
And what do you hope to achieve here during the Sweden Innovation Days?
Actually, we are here to announce one of our partnerships with a Swedish company called greenai.cloud. Customers that train their AI models using Green AI's cloud infrastructure can now use our technology to bring those models to the edge. And also, of course, we are meeting with several enterprises in Sweden, and we've had already few meetings this week. We have a few more coming up in the next few days, looking to expand our European business through Sweden.
Thank you. Congratulations to that, but also thank you for allowing me to have goosebumps at the end of a day that's been slightly frustrating in terms of how to achieve the big challenges of our time. And now moving to Koshel, tell us, what's that and what do you hope to achieve during the Sweden Innovation Days?
Hello, everyone. My name is Yun Chang, and yeah, actually, our company name pronounced as Koku.
Koku.
Anyway, yeah, Koku is we are based in South Korea, in Seoul, and we are a research-based company focusing on sound AI technology. So we are making a system that can understand any sounds just like humans. So, for example, it can understand like screaming, glass breaking, gunshot, dog barking, any kinds of sounds, and it's getting more and more powerful every day. And also, it can understand like human health-related sounds as well, like cough and sneeze, snoring as well. And we provide this to other companies through our API and SDK, so that they can integrate our sound AI system on their services and products.
And what type of services and products would that be?
It can be we are now doing like security camera for the screaming or glass breaking, gunshot detection, and also in the hospital it can be like cough and sneeze analysis, or in the sleeping monitoring for snoring analysis. That kinds of thing can be our applications.
Fascinating. And what do you hope to achieve during these days for Kokel?
Actually, the sound AI can be really applied to many like different things, and obviously sound is one of the human, like one of the main senses of human. And it can be really deployed anywhere. So we are actively looking for many business opportunities applying this sound analysis technology to many different industries. So but it only can be, I mean, we are really deep tech company, but this technology only can be meaningful only when it solves really critical problems. So we are like kind of looking for many different corporates and companies and try to find what will be really meaningful way to utilize our solutions. So yeah, we are looking for such opportunity through the Sweden Innovation Days here.
I have a tangent question that might not be relevant, but a piece of technology that I was looking into. Can you detect things within voice as part of sound? So could you potentially detect if someone is lying? Would that be different than someone telling the truth, for example?
Actually, we haven't tried like lying detection, but if it's more physical things related, like more Parkinson's disease or sleep apnea or hypomnia, this kind of thing can be more easier to detect it by our solutions. But like I think it's more mental related, like depression or lying. This kind of thing can be, there will be clue, but I think it can be a little bit less accurate compared to more physical things, I think, yeah.
Anders, I was just thinking, and maybe this is pushing it slightly too far, but for our next conference, having some sort of voice parameter understanding, how meaningful is this discussion? Are they genuine about it? So we can move from this talk part of the summit to really detect what's happening. What do you think?
Yeah, it sounds like a great idea. We'll contact you.
We'll contact you. Thank you, guys. Good luck with the matchmaking and good luck in finding partnerships. And we look forward to hearing about your successes.
Excellent. All right. Thank you very much.
Anders, it is almost 5 o'clock. I can't believe that time has flown like this. Exactly.
I know.
So many different challenges under this big umbrella of preventive health and well-being. Tell us, what are your highlights of today? What do you feel that was most important that we need to bring forward in your to-do list for Vinnova next week?
Well, on my to-do list, I don't know if I can go through it all. We don't have time. We need another day. But I mean, I'm so impressed with all the speakers and the panelists here today. It's been so interesting to listen in to what the system has to say. And I mean, to wrap it up, we realized today that preventive health is multifaceted. We've been talking about healthy food, clean air and water, physical exercise, antibiotics and antibiotic resistance, health technology and AI. So many different things that are needed here. And also it's very, very complex. It's obvious that no single actor can solve these challenges alone. And I just want to give an example of a word I learned, I think yesterday or the day last week, called perspective density, which means that you have to include different perspective, competencies, and experiences in the same room in order to achieve effective innovation. And that's something that's also become clear here today. So I'm very happy to hear that there's a great unity among the speakers and panelists here, that the only way forward is by collaboration. Collaboration is key, both nationally and globally. So what we need to do, I think the next step might be to agree on the societal challenges that we need to work on. Like, for example, we heard about childhood obesity. We had Ebba here from Vision Zero Cancer. They are perfect initiatives because they are important and they are easy to understand. And it's easy to understand how I, as an actor, can contribute to solve these challenges. And I think that we also heard missions-oriented innovation could be a great framework actually for tackling these challenges. And there are, as we spoke about yesterday, and to those of you who listened to Dan Hill earlier today, there is a framework for that. There is a toolbox that we can use. So I think that wraps it up from my perspective.
Because I think you're right. Perspective dense today has been perspective dense, but it's also been emotionally and conflictingly emotionally dense. Because I said this to Dan Hill yesterday after all the talks. So there's this combined feeling of hope, opportunity, initiative, forward-leaning, both on a regional level, on a local level, and internationally. But at the same time, it's permeated by this frustration. And you, just as you said, many of these things are complex. But when you listen to it, it's intuitive. It makes sense. So it's not intellectually complex that we need to combine these different perspectives. So therefore, it must be practically or emotionally or socially or processly, that's not a word, complex. And I think that's probably where we need to focus our activity.
I think so. I mean, finding challenges that are really easy to understand, that can, as you say, they bring about emotions, they bring about motivation to see that, okay, I can actually do something here. That's so important in innovation, and it's also something that we're trying to boost that, and mission-oriented innovation is a way to do that.
And the last panelist mentioned this, we don't know the future, and that implies something in the leadership. We know where we need to go, we know the mission or the vision of our challenge, but we don't necessarily know exactly what the steps look like. So we need to have an iterative approach. And also one of the things that we were discussing yesterday, which I think is relevant today, is we need to be kinder and humble and maybe more patient in when we solve these problems, because every step won't lead to the right answer directly.
No, I agree. And of course, the governance is really important here. And as I said, that was my comment about innovation policy, that we need to be able to stimulate innovation in an agile manner. And that's, for us at Vinnova, this is fairly new. I mean, we usually give project money and we know what we expect to come out in the other end. But here we don't know. It's becoming a little bit scary, and we don't know, does this work or doesn't it work? But as long as we have a clear goal and a directionality and all the necessary actors are there, then it's fine. We have to trust the system here.
But it's a timeline issue. If we don't know all the steps, we can't from the beginning say it's going to take X years. We will be done in 3 or 5 years. And therefore, I thought your cheeky question is relevant to the State Secretary. We need funding that has a longer horizon, and hopefully she got the point there as well. So let's do some shout outs for what's coming next. So at 5:10, we have a fireside chat with Ebba from Vision Zero again. We have side events, and at 6:30 p.m. we have a side event with Vinnova Silicon Valley as well. Tomorrow is a new day, a new challenge, a new theme, as well as Thursday will be the 4th day. Anders, I would like to say, even though you've been in another room and we've done this digitally, it's been an honor to co-moderate this with you.
Thank you. Likewise, Aurora. And good luck the remaining days.
I think, Anders, you're the one who needs the good luck, because your to-do list is long. Thank you. And thank you for today. And I will see you tomorrow. We start at 10 and I will be here on the main stage from 2 p.m.